The President. Urgent question. In addition to 6 oral questions, I've given permission for the Honourable Edward Leung to ask under Rule 24(4) of the Rules of Procedure an urgent oral question. Members have been informed that a maximum duration of 1 hour will be allowed for the urgent question. After the main question has been asked by the Honourable Edward Leung and the main reply has been given by the Secretary for Food and Health, Mr. Leung may first ask a supplementary question, and then the President will invite other members to ask supplementary questions. Members who wish to ask questions, please press the Request to Speak button. Each supplementary question should be directly related to the main question and should not contain more than one question. Questions raised by members should be as concise as possible. Members should not make arguments when asking questions. The Honourable Edward Leung. Thank you, President. A female security guard working in the Penny's Bay Quarantine Centre, or PBQC, was suspected of having infected with the coronavirus disease 2019 in PBQC last week. A few days later, a security guard working in PBQC who had close contact with her was also confirmed to have been infected. With the epidemic situation worsening recently, a large number of members of the public have been sent to PBQC for isolation. However, with PBQC alleged for its mismanagement and unsatisfactory hygienic condition, coupled with the fact that the transmission chains of the Omicron variant have yet to be cut as of now, the public are concerned about PBQC's failure to properly implement infection control measures, which may result in the spread of the virus or cross-infection at PBQC and even in the community. In this connection, will the government inform this council how it will immediately improve the infection prevention measures of PBQC and its management so as to prevent its staff from being infected and spreading the virus to the community? Secretary for Food and Health. President, the government has always adhered to the principle of stopping importation of the disease and spreading in the community. When it comes to prevention of spread of the virus in the community, the Center for Health Protection of the Department of Health, whenever has found confirmed cases of the variant or the virus, will implement very strict contact tracing and quarantine and testing measures. All close contacts of confirmed cases will have to undergo mandatory quarantine at quarantine centers, since these are high-risk persons. So the government attaches a lot of significance to the preventive centers to ensure the safety of staff and to stop the spread of the virus into the community from quarantine centers. All staff working at quarantine centers have to don proper PPE, and if they have to carry out duties at high-risk locations, they have to be fully geared, including face shields, face masks, caps, and also gloves and gowns. And they have to adhere to all the preventive measures against infection. And all staff working in quarantine centers are considered high-risk persons. So they are required to have received 2 jabs of the vaccines, and they have to undergo tests every 2 days. The government attaches a lot of significance to the infection of 2 contract security guards working in PBQCs. They were confirmed COVID-19 cases. Once we're informed, the Civil Aid Services staff working there have immediately thoroughly cleansed and sterilized places where the 2 security guards have worked in the center. And all staff have been reminded that if they feel unwell, they should seek medical help as soon as possible. And then after epidemiological investigation by the CHP, 18 security guards are regarded as close contacts and they are receiving mandatory quarantine in the center. With the development of the pandemic, close contacts of the PBQC has risen substantially in recent years. And some individuals during the quarantine period were not tested before the end of the quarantine period, and they were delayed in terms of leaving the QBPC. We apologize to people affected, and we have introduced immediate improvement measures. We have boosted the staff of PBQC to enhance communication mechanism with persons under quarantine and to review the operation of different departments concerned to avoid a repeat of such incidents. I'd like to state to members that we have the following 4 preventive or enhanced measures. First, we boosted the manpower. The Department of Health and CAS have boosted manpower there, and we've increased the number of contract staff to enhance the operation of the PBQC. The Fire Services Department has seconded staff on a temporary basis to assist the operation of the PBQC. The number of workers has increased from 600 to about 1,000 at PBQC. We also supervise information or data in the computer. Say has reviewed all information or all data entered into the computer system to ensure that the people who are admitted and are discharged are properly confirmed. And we are receiving a surge of inquiries at PBQC, and so persons under quarantine may have their inquiries answered at a later stage. To enhance the system, we use SMS and instant communication apps to deal with such inquiries to reduce the number of repeated inquiries. The Department of Health has also introduced a special 24-hour hotline for persons on quarantine to inquire about when they can leave the PBQC. And we've also got an interdepartmental coordination center formed by departments assisting in the operation of the PBQC under the leadership of Department of Health. When there is a sudden surge of members admitted to the PBQC, the coordinating working group would boost its operation to enhance communication among departments and expedite the workflow of the quarantine center. We understand that the epidemic measures would cause inconvenience to the public, but then quarantine is a very important element in preventing the spread of the virus in the community and has proved to be effective. In the past 2 years, 68,000 or so persons have undergone quarantine in PBQC. Over 2,700 or 4% of those admitted became confirmed cases. Once again, I'd like to thank frontline staff for their hard work, and we appeal to the public for their understanding so that we can fight the virus together. We will learn from our experience to enhance the quality of the operation of the PBQC to ensure public health. Mr. Edward Leung. Thank you, President. The first security guard infected was in fact infected by a confirmed case in the PBQC, according to press releases, and as mentioned by the secretary, the security guard was in full PPE when working, including their gown, her gown, a face mask, face shield, cap, and gloves, and she adhered to all infection control measures. How come with full PPE and also full prevention control measures, she was still infected? Is it because the confirmed case was not wearing any mask or in any protective gear? So have you found out the reasons for that, and what measures do you have to plug this loophole to ensure that staff working at PBQC will not spread the virus into the community? Secretary, thank you, Mr. Leung, for your question. On one hand, government attaches great significance to this incident. Now, for frontline workers of PBQC, now as regards their infection control knowledge and whether they can strictly adhere to the measures, well, we have enhanced training. They've been given sufficient guidelines. Staff of CAS will enhance the supervision to ensure that frontline workers have followed the procedures. well, we have staff infected, but then these measures will lower the risk of infection. Besides, PBQC is a high-risk location, and workers working there are high-exposure groups. So, as requested by the SF, the Food and Health Bureau, they have to be tested on alternate days. That will give us a chance to identify positive cases for isolation as soon as possible. When we have silent transmission chains in the community, the whole city has to be vigilant, and we must observe good personal hygiene. So we will enhance our work in this regard in the PBQC. Please turn your mobile phones to the silent mode. Okay? Mr. Michael Tian. Mr. Michael Tian. Thank you, President. Secretary. Well, one day is one too many as far as the epidemic is concerned. We're concerned about infection control at PBQC, but we're also worried about the risk associated with the hamsters, because if we don't address this issue, it's useless no matter how hard you improve the services of PBQC. Now, this is a difficult position. Some people are unhappy with the culling of hamsters, but you have no other choice. All right, for those purchased after the 22nd of December, you advise people to hand over the hamsters to you. Why don't you make it mandatory? Now, if you think there is a risk, then you should make it mandatory. If you just strongly advise people to hand over the hamsters to you, well, there is some contradiction here. Mr. Michael Tian, the question is about how the security guard got infected. And your question is not directly related, but Secretary, do you have anything to respond? I'll give a simple reply. PBQC is very important for preventing the spread of the virus in the community. But then, as mentioned by Mr. Michael Tian, our experts and the AFCD have explained time again that we must minimize the risks as far as possible. Now we are asking members of the public to call the AFCD and to hand over hamsters bought after the 22nd of December. The intention is to minimize the risks. We strongly advise pet owners to do so. And of course, if there is any legal means, we can make it mandatory. But we believe everyone has to chip in fighting the pandemic. And there are already pet owners who have called the AFCD to hand over their hamsters. May I remind members that the supplementary question must be directly related to the main question. Ms. Chen Hoyan. Thank you, President. The Secretary said that manpower has been boosted in PBQC. The numbers may look a lot, but in fact, it's just very limited because the government has failed to stop the importation of the virus and spread of the virus and the disease. In some shape, there are various transmission chains. One confirmed case can have numerous close contacts. So I'd like to ask the FHB whether there are standards and guidelines for contractors to boost their manpower, and when we can have another quarantine center to accept close contacts. Secretary, thank you, Ms. Chen, for your question. Now, for the recent incidents associated with PBQC, the government has convened a few meetings to review the situation. The CS4A has led myself and the Secretary for Security and representatives from departments in an interdepartmental meeting to discuss the manpower requirement at different steps and bottlenecks and how we can address them. Corresponding improvement measures have been put in place. In my May reply, I said that we have boosted the manpower of PPQC, but that is only one of the steps we have taken. We note and understand that there are different bottlenecks, some not related to a lack of manpower. Some might be with the use of a computer, and some might be because many people were admitted at the same time. For instance, on the 9th of January, at the same time, we had 800 close contacts of confirmed cases and household contacts of close contacts, and also cases related in vertical transmission cases waiting to be admitted. In fact, we've also got 3 quarantine hotels for close contacts. We've also got the Cyclone Holiday Camp and also the JPC Outdoor Recreation Center on standby. They can be activated where necessary. We've also got the Leyun Moon Holiday Camp. A total, we have 7,000 odd units, together with the 3 quarantine hotels for close contacts, providing over 900 units. Now, these facilities together give us over 4,500 places. Thank you, Mrs. Regina Yip. Thank you, President. I thank the Secretary for telling us how much resources have been boosted, but it appears that you have yet to find out the reasons or the roots of infection for the security guards. Do you admit that so far you cannot identify the route of transmission for those confirmed security guards? Now, from epidemiological investigation, our staff of CHP have been trying to understand the situation. There may be various reasons. Genome sequencing of these 2 confirmed cases have been matched with that of other confirmed cases, so they are still doing the investigation. The important thing is we have infection prevention measures to ensure that they are properly done to avoid infection of our staff. Ms. Horace Zhang. Thank you, President. I commend the dedication and commitment of frontline staff, including those from Department of Health and also CAS. People admitted to quarantine center really want to cooperate, but then as soon as people are admitted, it's a matter of survival, because once they are quarantined or isolated in the room, they are cut from the rest of the world. There is problem of food and need for medication and chronic diseases that need looking after, and the elderly feel isolated. There is no mental support, etc. And then the hotline is always unanswered. We have received many complaints that the hotline is not answered, but according to the administration, things are operating smoothly. The CAS is responsible for operating hotline, but if your calls are unanswered, your needs are not attended to, you're helpless. So instead of asking CAS to operate a hotline, can there be an interdepartmental working group responsible for managing the quarantine center? And there is a higher level of government official to coordinate and to sort out the coordination issues among government departments.
Secretary, thanks very much, Mr. Zhang. Through various meetings, we have been trying to identify where the bottlenecks lie. Mr. Horace Cheung mentioned problems relating to communication with the quarantinees, and sometimes they will have to wait a long time before they can have any communications. Now we have increased the number of telephone lines, and maybe this may not be enough if everybody is trying to call in. Second, we have reduced the quarantine period from 21 days to 14 days. The DH has designated a hotline to address questions from the quarantinees regarding the date of the departures and so on. So at this present moment, we have to maintain communications with the quarantinees, and for that we have to increase the hotlines and also the manpower, and we also need to communicate with them by way of WhatsApp or email and other means. So we have been making our utmost efforts in this regard. One of the ways is to deploy more manpower to man the hotlines. Things have seen some improvement now because there are fewer people in Penny's Bay, and we also have other hotels available. And we also have reduced the period from 21 days to 14 days. And there are people leaving Penny's Bay in batches. And there may be a vertical transmission. There may be an upsurge in close contacts that will aggravate the situation. In particular, if we have a large number of coming in and going out of the quarantine center, we need to have interdepartmental coordination. We are enlisting the support of the FSD, and we will be ramping up the efficiency of the Penny's Bay Quarantine Center. Ms. Yun Zhong, well, the Secretary said that work will be enhanced. I agree with that, but I think we have to make sure that the CAS and also the security guards will be protected against any infection. The Secretary said that there will be more manpower, that there will be double checking of the record. From certain reports, the security guards were changing clothes and having meals in the container box common room. Have you looked into the problems in these areas, like the air change and ventilation? Secretary, indeed, the security guards are sharing the common room for meals. Now, we have scrutinized the situation. We have stepped up the measures. First, we have to be alive to the cleanliness of the common room and also the disinfection. We're also reminding the security guards that during meals they have to space out with one another, and after meals we reminded them to keep the mask on, and if they want to engage in conversation, they have to keep the mask on. And we've also asked them not to engage in any conversation during meals. In terms of cleanliness and disinfection of the common room, we have already stepped up our action. Under the present circumstances, the risk of infection during meals has been substantially reduced. Dr. Elizabeth Quat, President, we have been fighting the epidemic for 2 years, and Penny's Bay has been around for some time. The CAS has been working really hard. They're working so hard, but the effectiveness seems to be leaving a lot to be desired. After 2 years of Penny's Bay, there are so many operational problems. The Secretary mentioned the bottlenecks, and they have to guard against any importing error. Now, you have these repeated importing error. There are sometimes two people sharing the same room with one lunchbox, and they have to be kept waiting for hours on end before they will leave, and nobody can get through to the hotline. I know that you are very, very backward in your anti-epidemic work. If you do not harness technology, then I'm sure that you will be faced with all these bottlenecks and all these repeated errors. So my question is, will the Secretary be utilizing technology like the unified operational platform and share resources in order to guard against any inputting error? And also you will help the DH staff and the PBQC staff and to minimize their workload. If they're too busy, they're liable to make mistakes. I think you have to revamp the way you operate. Secretary said that with fewer people, it's less chaotic. If there is an upsurge, you might be liable to run into the same problem. Are you going to use new technology? Secretary, thanks very much, Dr. Quat. Now, Dr. Quat mentioned that we should use technology, and she pointed out the inadequacy there. In our internal review, we have also touched on this issue, and we have to make improvement to make sure that different departments will not lead to duplicate the inputting process, and we will be harnessing technology to streamline the process and to increase the efficiency. We have looked at every single areas. The CS is procuring and sourcing some communication devices and software to handle the large amount of inquiries. So at this point in time, we will try to make sure that we will use some information technology to streamline the process and also to increase efficiency. Dr. Chunis Ho, President. Earlier in the quarantine center, I asked the Secretary and the CE to spend some time in the camp themselves. This stands to reason because the policymakers are really cut off from reality. You are seated in your in the comfort of your own office, and you're not aware of what's happening on the ground. There were 100 or so people who had to be admitted to the quarantine center, and I said that for those who are suspected to be infected, they should go into the camp themselves. They don't have to be waiting for these 18, 16-seater to pick up these people. If you load them up with too many people, there may be cross-infection. Can people turn up at the camp of their own accord? Dr. Ho, please speak to the subject. It is precisely about the operational problems. Dr. Ho, it's not about operational problem. It's about the security guard getting infected. That's the main theme of the question. Please speak to this theme. Yes, I'm speaking to this theme. I think the way this is handled is leaving a lot to be desired. I think we have to make sure there will be no cross-infection, but also facilitate people in this area. Secretary. Thank you, Dr. Ho. In our review exercise, we will increase the manpower. There are also a whole host of measures to ramp up the efficiency of the quarantine center. As we mentioned, we will improve the information technology. We will make sure that accuracy will not be compromised. Now, for people being admitted and being discharged, this is a statutory requirement, so the DH will issue statutory quarantine orders to the quarantinees. By the time they are discharged, we have to be careful to make sure that they have already had a negative test result before the quarantine order will be lifted. So for admission and for discharge, we do have to follow the statutory procedures to make sure that everybody will be safe. So under this premise, we have reviewed different elements like the manpower, the ICT, and also the streamlining of the procedures and so on. We have seen fewer people in Penny's Bay, but we have not lost sight of this element. We will make sure that we will take full advantage of the information technology to streamline the procedures. Mr. Tang Fei, President, Secretary Chen, will you clip on the mic on your lapel, please, Mr. Tang? Thank you, President. Secretary Chen, I'm grateful to the personnel at Penny's Bay, the CAS and others. Now, for the female security guard, she was infected. There are so many theories. Some said that there was no physical contact, and she got infected through the screen on the window. Now, there is a possibility that she might have been infected elsewhere, other than Penny's Bay. She might have infected off work in the community. In the community, as we are aware, there are so many unknown sources of infection. And when she got infected, she passed on the virus to Penny's Bay. And that's one of the theories. How can the government make sure that there will not be transmission into Penny's Bay from the community? Secretary. Now, for the staff working in Penny's Bay, they have a high exposure to the risk of infection, so they have to be vaccinated. And also, the frequency of testing is pretty high. In the quarantine center, we will impose the infection control measures to minimize the risk of infection. But like the member said, in the community out there, if there are chains of transmission, we would urge the members of the public to go get tested. I would do issue the CTN, the compulsory testing notices. Indeed, there are so many residents who are getting tested on a voluntary basis. If people are feeling unwell, if they are worried about the situation, they should go get tested in the community, like where they live. They are worried about the risk of infection. They should go and undergo testing to ascertain whether they are indeed suffering from any infection. Mr. Lai Tong Kwok. President, a moment ago, the Secretary said in her principal reply, paragraph 3, she said that the CAS has increased the manpower, or has reminded the personnel to seek medical attention if they feel unwell. And this is intended to identify the sources of infection. How can you educate the frontline staff to make sure that they will not get infected? The Secretary mentioned that they do have the full PPE. That's important. What is more important is that the staff members at Penny's Bay is constantly exposed to the risk. So will you equip the personnel with good enough knowledge? My question for the Secretary is this. Prior to the staff members taking up the post, what sort of training or anti-epidemic training has been made available to them? Is there any refresher course, any particular instruction prior to them getting started at Penny's Bay? Secretary, thank you very much, Mr. Lai, for the question. First of all, for the security guards, we would arrange for them to acquire the specific knowledge, and when they enter these high-risk places, they have to be kitted out with face mask, face shield, the gown, cap, and gloves, and a whole host of all these gear. And they have to observe all the anti-infection protocol. Prior to them taking up the post, they would undergo training with these security guards are contracted workers, and we do have requirements expected of them. Inside the quarantine center, the CAS would inspect the places to make sure that the security guards are really measuring up to the infection control protocol. So given that, we do have the guidelines, we do have the requirements, and we'll make sure that they are up to the job, and we will enhance our work in this area. And we'll make sure that the security guards, or indeed anybody working there, will be protected against any infection and minimize the risk. Mr. Yong Kit, President, the Secretary mentioned the improvement to be made to Penny's Bay, but she didn't talk about the inadequacy of the facilities. She mentioned 4,000 rooms for quarantine. Now, if they are occupied, or after they've been occupied, we'll have to wait quite a bit for them to be used again. If there is an upsurge, will there be any additional facilities? Will the administration expand the Penny's Bay Quarantine Center to cope with the situation? Now, this is not directly related, but will the Secretary make a response nonetheless? President, thank you. At Penny's Bay, as I said, we have 3,700 units available. We also have other centers like Sai Kung Holiday Camp, the Pak Hang, JPC, Lei Yu Mun Holiday Center. Now, all these taken together would have quite a number of units. Now, we have 3 quarantine hotels for the close contacts. Now, there are some that they are in Chinwan and Kwun and elsewhere. Now, for these hotels, they are providing well over 900 rooms for the close contacts. Of course, we would review the situation on a daily basis. Now, for the 3 quarantine hotels, we are discussing the 4th one in addition to the 3 hotels. And we will try to increase the turnaround time at Penny's Bay. We have already commissioned the contractors to make sure that the cleansing and disinfection work will be speeded up to make sure that the units would be adequate to meet the needs. The development of COVID is also a key element. The CHP, of course, will try to keep the COVID situation under control to minimize the number to be sent to Penny's Bay. Mr. Standing President, well, COVID has taken a turn for the worse, and together with Mr. Kwok Wai Keung, we have written to the Bureau to make some inquiries. Today, I heard from the Secretary, and I think this is filling us with some worries. COVID has been with us for 2 years now, and we're still emphasizing the fact that they are doing the utmost to cope with the situation. This is not good enough. I think we have to improve the prevention mechanism. In Penny's Bay, we have received an awful lot of complaints from the quarantinees. And I'm sure that the government officials will get pretty good care, but not so much for the ordinary citizens. I know that the frontline staff are working really flat out. And I get a feeling that the administration is in a very passive situation. And you tend to close the stable after the horse has bolted. We don't really want to see the horse bolted in the first place. So I think we have to be dynamic in our operation. I think we have to have the mechanism to tackle an upsurge in the situation.
Mr. Standing Ng, a moment, please. In relation to urgent oral questions, the justification is that if we don't have the question asked, there will be serious consequences. So we allow the question. But then the main subject is that we want to know why the security guard got infected. It isn't so much about the management of the Penny's Bay Quarantine Center. You can take that up with the secretary on another occasion. So I do hope that members will speak to that subject. Many members are in the queue. Perhaps they are really interested in the infection of the security guard. So I really hope that, first of all, you won't be making a statement, expressing your opinions. Please come to your question immediately, and please center it on the subject of the question. Mr. Standing Ng. Thank you, President. I want the Secretary to tell us whether we can be dynamic, whether we can take the initiative to come up with an infection prevention and control approach instead of being passive. We can't be mending, we need to be proactive. Secretary, please be brief with your reply. Thank you, President. Thank you, Mr. Ng. Major public health incidents, like in the case of an infectious disease outbreak, gangs, in fact, the back are not being tightened up. Now, for the 21-day quarantine period, well, it has been shortened because of the shorter infectious period of Omicron. But then we have the Delta strain as well. Are you going to make a change to the quarantine duration? Otherwise, the community will be affected. Secretary, thank you, President. Thank you, Dr. Lam, for your question. We do take it seriously as to the non-professional staff, that is the lay staff, who work at the Penny's Bay Quarantine Center, because they're exposed to high levels of risk. Other than getting vaccinated, they have to be frequently tested for the virus. Well, infection control is indeed important. Now, generally speaking, the security guards are contract staff. According to the contracts, the contractor must make sure that supervisors must attend infection control training, as well as the use of the PPEs arranged by the Department of Health, and they have to carry out drills. The relevant supervisors will make sure that security staff or security guards, as well as other staff members, will receive the same training before they start their work. Now, of course, we have seen that for Delta and Omicron, there are two strains in the community. We are still carrying out our tracing work, and we want to prevent an outbreak in the community. At the quarantine center, for the quarantine period, it is still 14 days. But of course, we will be keeping a close eye on the development. Mr. Chen Yong, thank you, President. I would like to thank the Department of Health, the security guards, the civil aid services, the frontline staff members, as well as the Secretary for the hard work. Well, for the DB, on average, every day we get 1 or 2 inquiries and requests for help from the people in the quarantine center. They don't get tested, they don't get through their hotline, they don't get the necessary supplies, and there are delays in transport. I think it's all because of the sudden surge in the number of people being admitted. I used to be with the CAS, and I don't think we can rely on civil servants only. For the security guards, I'm sure there will be a lot of loopholes in the chain. we have to make sure that all the loopholes are plugged, and then things will get smoother. So the Secretary has talked about an increase in the manpower. And what about bringing the other 3 quarantine centers into operation earlier? I think you can always mobilize the civil servants. And what about senior level coordination? Can we not have an officer in command for the quarantine center at a senior level so that we can go after him or her? And we want to cut the chain of transmission, ensuring the safety of people working there, including the security guards. Secretary, I'd like to thank Mr. Chen for his question. On the one hand, for the operation of the PBQC, problems have been identified. In fact, we are really concerned, and we have paid attention, and we have introduced improvements immediately, and we have ramped up the manpower. Instead of 600, there are now almost 1,000 people working there. Now, for the deployment, well, for the disciplined services as well as other civil servants, they have been mobilized to answer telephone calls, to make arrangements concerning admission and discharge of people quarantined. We are making improvements. There are a number of measures that we want to rely on to enhance the efficiency. Say, for example, deploying more experienced members there to beef up the information systems so as to speed up the inputting of data and ensuring its accuracy. Mr. Chen asked for the introduction of a commander-in-chief. I think the Department of Health is in charge of a quarantine center. The CS, in relation to admission, discharge, and communication, will be relying more and more on information technology so as to streamline the procedures. Many of you are concerned about the inquiries as well as the follow-up work. We have asked the Department of Health to deploy a communication officer so as to answer inquiries concerning testing and other medical issues. Well, in future, when there is a mass admission or mass discharge, then we are going to have a coordination center so that different departments will man the center to make sure that the communication will be instant and we can deal with any emergencies immediately. Of course, the CS and the Department of Health will make sure that there will be FAQs for the hotline so as to improve the efficiency. There may be a lot of inquiries of the same nature. So it's a matter of providing the information instantly instead of having to answer the questions repeatedly. So we're making improvements on all fronts. Ms. Judy Chen. Thank you, President. Just now, the Secretary mentioned, and of course, Mrs. Yip has asked why the security guard got infected. I know very well that there are 2 possibilities. Security guards are really too busy. They work at the front line. Let me share an example with you. I was admitted at 3 p.m. They didn't have their lunch yet. At 11 a.m., I was discharged, and they haven't had their breakfast. So they were so busy that they were not able to have their meals, and therefore they might have forgotten about the need to have disinfection. And then there were problems with communication. There was delays in providing information. So citizens who are quarantined there have no one to turn to for help. Whenever they have an urgent need, they will certainly open the window. They will even open the screen so that when security guards come around to distribute the meals, they will try to ask security guards for help. Ms. Judy Chen, please ask your question. I think there is indeed room for improvement. Secretary, just now you said that you would increase the manpower. But for the increase of manpower, how many more workers at the front line and how many more in the back office? I think there are many problems with communication, resulting in delays and poor efficiency. I want to know, when you talk about making greater use of IT and having an interdepartmental coordination center, it all sounds good, but when are we going to get it? Secretary. Well, for the PBQC, well, it has been in operation for a period of time. All along, there is a well-proven mechanism. But of course, we've learned a lesson from this experience. Probably, as Ms. Chen has pointed out, at the PBQC, a large number of people were admitted. At its peak, there were over 3,000. And then there might be days that we had to admit 800, 900 people. So in terms of coordination, I think we've seen that we need to beef up the coordination. Ms. Chen told us that she would like to know more about the coordination center. For this coordination center, it means that if we have a large-scale operation, say, for example, for a particular building, we have to evacuate a large number of residents, or there are also other scenarios that would necessitate the triggering of this mechanism, then we will do so. Otherwise, departments will be coordinated, and then for bottlenecks that we have identified in this incident, we will try to sort out the problems. So it takes coordination, it takes changes to the procedures, improvements to the procedures, and we need to have a greater use of the IT. Mr. Chow Siu-chung. Thank you, President. For the PBQC and the issues with its operation, I think it is mainly because of a lack of manpower. People can't get through the hotline. People have to wait a long time, unduly long time for admission and discharge, among many other issues. Well, when it comes to manpower planning, I think it should have been done before the outbreak or in the early phase of the outbreak. Now that we have already got an outbreak, and that we are getting many people that have to be admitted to the QC, I'm sure errors and mistakes are bound to emerge. Now the administration has been criticized, and then you now say that there will be a beefing up of the manpower, but a mere 400 more workers. I know a government driver. He told me that he has taken part in the CAS emergency delivery. Now, in fact, the department told him that he had to use his own leave to provide the service. I think it is a matter of poor coordination. Well, the outbreak is getting serious. I want to know if the administration has got a more comprehensive manpower planning. Otherwise, you'll still be having this ad hoc approach. I think we need something more long-term, and it isn't just for the PBQC. You need to have a good look of the flow of the procedures. Maybe there is lack of manpower throughout. Secretary, I would like to thank Mr. Chow for his question. Indeed, he's right. When the pandemic has eased, while we are preparing for the fifth wave, we need to have a contingency plan. And there are many different elements, not just about the quarantine center, but also about testing capacity, manpower for tracking and tracing, as well as infection or isolation beds in our hospitals. We need to plan ahead. For the PBQC, on this occasion, indeed, we have learned from the experience. For the short-term issues, we do have a long-term plan to deal with them, be it manpower, be it IT. And in fact, we want to have a smart quarantine center. That's what we want to aim at. The civil aid service is helping us. Do we need more than the CAS? Should we be deploying others so that they will be mobilized immediately while they are on standby? Dr. Tang, Mr. Dr. Tang, President, in relation to the PBQC, a security guard or 2 security guards were infected. There are 4 points to remind the secretary. First of all the workers have their PPEs, and you have told us that they had the mask, they're fully covered, and they have got the goggles as well. But I want to know, is it really the case every minute for everybody? Because it seems that that wasn't the case. I need to draw your attention to that. Secondly, in fact, the rooms are too crowded. You can see each other, and then the doors are facing each other. That would enhance the transmission of virus. You have to pay attention to that. And then thirdly, for the air conditioners, they're the window type air conditioners. If everybody turns on the air conditioner, then the virus inside the room may be discharged out of the room, and then there would be virus transmitting in the corridors. Have you noticed that? And fourthly, I know that there is a window facing the corridor, and then it can be opened wide. In fact, some people have been opening the window for better ventilation. You don't disallow them to do so, but then I'm afraid the older the virus will go to the corridor. And then when the workers send supplies to the quarantined people, there will be a risk of getting infected. So I hope you will pay attention to that. And please let us know whether you have paid attention to that. Secretary. President, I would like to thank the member for his question. Well, on the one hand, there are 4 points in his questions. First of all, protective gear. We have certainly paid attention to that. Other than having a sufficient supply, we have also got sufficient training so as to make sure that they really practice what they have been trained so as to minimize the risk. Other than the protective gear, well, in the staff common room and during their meal breaks, we have also provided more guidelines to make sure that they are urged not to chat, and when they're not eating, they should wear their mask. And then at the time the PBQC was constructed, we knew that it's for the purpose of quarantine. And I know that relevant departments have borne that in mind, like the Department of Health as well as the Electrical and Mechanical Services Department. So they have paid attention to ventilation, air change within the room and among the rooms. I'm sure they have made reference to expert opinions concerning infection control and prevention. We will pay close attention to this. Now, for the variant, I know that there are sort of new information concerning the route of transmission. So in the light of the development of the virus, in the light of the additional scientific data concerning the additional routes of transmission of the mutation variants, we are going to make changes. We are going to make adjustments to the infection control and prevention measures at the quarantine center. The last one to ask questions would be Mr. Liang Wenguang. Thank you, President. I agree that the frontline staff are exposed to the highest level of risk, and the department, the bureau, have already provided protective gear to them. But then they have only got very brief training. They are under a lot of pressure. There are just so many people who have been admitted to the quarantine center. Now, there are online shops that are publicizing their service to send the supplies to the quarantined people. Security guards and other frontline workers are under huge pressure because they're worried that they will bring the virus back home. Now, you're saying that they shouldn't chat, especially over meals. You say that this will lower the risk of transmission. But then I want to put this question to the Secretary. Now, for such staff, they haven't got much training. They've only got some brief training. Would you like to replace them with other civil servants like the disciplined staff so that they are better aware of the infection control measures? You have asked a question. Thank you. Secretary, I'd like to thank Mr. Leung for his question. As Mr. Leung has rightly pointed out, at the front line for the working environment and as well as the infection control measures, we are being very strict about the frontline staff members. We have stringent requirements of them, and I'm sure, and I can agree with you, that they are under huge pressure. I'm very grateful to the frontline officers, health workers, security guards, CAS members, cleaning staff, anybody working in the PPQC. I'm most grateful to them for their dedicated work. I hope whether the pandemic is raging or whether the pandemic has eased, they have always been dedicated, and many of them have clocked overtime work. Will of course be getting more manpower in anticipation of large-scale operations with mass admission or mass discharge of quarantined people. We are going to sort of review the experience. We try to see we need to beef up the establishment of our staff there on a standing sort of basis, and what we should do for the purpose of better coordination in future large-scale operations. Well, in fact, as I have mentioned, there are a number of measures that we're going to take up so as to make sure that the PPQC will provide a safe environment for the purpose of quarantine for everybody. And we hope that we can enhance the efficiency and effectiveness as well. That's the end of the urgent oral question.
Questions. In accordance with Rules 9A of the House Rules, the time taken by each oral question should not exceed 22 minutes in total. After the member has asked the main question and the relevant public officer has replied, the member who asks the question has priority to ask the first supplementary question. Other members who wish to ask supplementary questions, please press the Request to Speak button and wait for your turn. Each supplementary question should not contain more than one question. Questions raised by members should be as concise as possible so more members can ask supplementary questions. Members should not make arguments when making or when asking questions. Question 1. The Honourable Maggie Chen. Thank you, President. Taking into account the economic, social, and financial situations at different points in time, the current government had in the past dispersed cash to the people with the support of the public, and some of the view that their pandemic is not yet over, and then the government should continue to implement relief measures. In this regard, can the government inform the council whether there will be disbursement of no less than 5,000 consumption voucher scheme to the public? If so, the details of not the reasons for that. And if you take into account the impact of the consumption voucher scheme on the public, and have you considered the impacts of the various schemes on different strata and various trades and industry? If so, of details, if not, the reasons for that. And 3, given that chaos arose in the past when the government implemented schemes for dispersing cash or consumption vouchers, for example, a large number of elderly persons who submitted paper application forms have to queue up for a long time for the procedure of submission of registrations, whether the government has learned from such experience to prevent the recurrence of similar problems, and whether it has considered allocating resources for cooperating with grassroots organizations, various districts, to enable such organizations to assist the government in the publicity and registration matters. If so, of the details, is not the reasons for that. Financial Secretary. President and members of the Council, good morning. Taking into account the economic, social, and financial situations at different points in time, the current government has in the past disbursed cash to people, including implementing the caring and sharing scheme in 2018 to disburse $4,000 to each eligible Hong Kong residents aged 18 above, with the aim of better realizing of sharing the fruits of economic success of the public, and a cash payout scheme in 2020 to disburse $10,000 to each eligible Hong Kong permanent residents aged 18 above to relieve people's financial burden and to encourage local consumption. I've also announced in the 2021-22 budget the implementation of the consumption voucher scheme, under which electronic consumption vouchers with a total value of $5,000 will be disbursed by installments to each eligible Hong Kong permanent residents and new arrival aged 18 or above, so as to boost local consumption with a view to accelerating economic recovery, as well as to encourage more local merchants and public to use electronic payment, thereby fostering the extensive use of the local electronic payment. My reply to the different parts of the question raised by the Honourable Chen is as follows. Since the 1st of August 2021, eligible people under the scheme have successfully received consumption vouchers via the 4 stored value facilities in batches. As at the 31st of December 2021, consumption vouchers of a total value of about $30 billion have been disbursed to over 6.3 million successful registrants. The overall response of the community towards the scheme has been very positive and considers that the scheme has helped to boost the economy by stimulating consumer sentiment. I'm currently conducting public consultation to gauge the views of various sectors on the 2022-23 budget. As resources are limited, the SL government, in deciding whether to disburse consumption vouchers again or launch other similar initiatives involving a large amount of public funds, has to consider relevant factors in a prudent and holistic manner, including the social and economic situation, the impact on social livelihood arising from the outbreaks of the epidemic, and the current financial situation, etc., in order to ensure that the measures are in the current interests of Hong Kong. Before launching the scheme, the government economist has roughly estimated that the scheme would have a stimulus effect equivalent to 0.7 percentage point of the GDP on the local economy. The latest statistics released by the Census and Statistics Department shows that even with the low base effect gradually dissipating, the value of total retail sales still grew by 9.6% year-on-year between August and November last year. That is the first 4 months after the consumption vouchers were disbursed, which was higher than the average growth rate of 7.6% between January and July in the same year. The value of total restaurant receipts rose by 43.9% year-on-year in the third quarter of 2021 against a low base of comparison, while private consumption expenditure in the same quarter also grew by 7.1% year-on-year. This shows that the scheme has helped stimulate local consumer sentiment and has achieved the intended result. As to the effectiveness of the scheme in boosting different segments of the community, we will conduct an overall assessment after its completion. Over the period, the labor market has continued to improve since the beginning of last year, with the unemployment rate declining gradually from a high of over 7% in early 2021 to 3.9% by the end of the year. Moreover, the underlying composite consumer price index inflation rate rose from 0.3% in the second quarter to 1.1% in the third quarter and averaged to 0.5% the past 11 months of 2021. Consumer price inflation went up in the second half of 2021 but remained moderate overall. Apart from the positive impact on local consumption and the overall economy, the scheme has helped foster the development of the local electronic payment market. Since the government's announcement on the 11th of April last year that 4 stored value facility operators, that is, AnyPay Hong Kong, Octopus Tap and Go, and WeChat Pay Hong Kong, had been selected to help implement the scheme, the 4 operators had, as at the 31st of December, altogether attracted over 4.7 million new users and 96,000 new merchants. They also indicated that there had been a significant growth in the number and value of transactions processed by them since the implementation of the scheme. In the course of working out the implementation details and arrangements of the scheme, the SL government has strived to cater for the needs of different people and stakeholders. In terms of the registration process, we've endeavored to strike a balance between security and simplicity. During implementation, some registrants had to resubmit their registrations due to incomplete or incorrect information provided on their paper forms, resulting in a sudden influx of visitors at the Secretariat and hence longer waiting time. We had to respond immediately, including extending the period of special arrangement for resubmission to 1 month, increasing substantially the manpower of the Secretariat, and making available additional service hours at the Secretariat on Sundays. With the implementation of these measures, visitors queuing for the Secretariat's services had largely subsided. To further facilitate people making resubmission of registrations, we had also set up 3 additional service centers in other districts within a few days. In fact, in the course of planning for the scheme and before the commencement of registration, we have liaised with different political parties, organizations, and institutions, including district organizations, NGOs, social welfare organizations, and residential care homes serving the elderly or persons with disabilities, etc., to brief them on the details of the scheme and the registration procedures. We also provided them with the registration forms and publicity materials to facilitate them to assist their clients to register for the scheme. With the support and assistance of different parties, the scheme has finally been implemented smoothly and has achieved the expected result. I would like to express my sincere gratitude to all parties inside and outside the government for the assistance, support, and active participation. Ms. Maggie Chen. Thank you, President. Thank you, Secretary, for his reply. The Secretary said that there will be an overview after the consumption voucher scheme is over. Now, we have been fighting the pandemic for 2 years. Now, employers and employees alike are in deep waters. I'd like to know when. Now, we are in a dire situation. We're not waiting for a review. And the FS has yet to reply how you can avoid the elderly persons from queuing up for a long time. Ms. Chen, you can only ask 1 supplementary question. You've asked 2. FS. Thank you, President. Thank you, Ms. Chen, for your supplementary questions. In my main reply, now, I have already given account of the impact of the scheme on various sectors. Take the retail sector as an example. In October and November, the overall turnover was close to $30.7 billion, a long-time high. Compared with what it was before the Black Cloud violence, we were still a little bit behind because the borders with the mainland are not yet open. Once that is achieved, there will even be a greater impact on the retail sector. Now, for restaurants, there has been over 8 billion receipts every month, and then the unemployment rate has fallen from a very high point to 3.9%. So the scheme has been very useful in boosting consumer sentiment and stimulating the economy. Thank you. Mr. Xiu Kafei. Thank you, President. Last year, the Liberal Party was the first party to suggest the FS to implement a consumption voucher scheme. And when the scheme was announced, in the 1.5 hour on radio filming program, there were people who called in to criticize and FS address those complaints, and I also helped to explain to the public how useful the scheme could be. Now there is no need for us to explain further because the scheme has helped various sectors and consumer sentiment and lower unemployment rate. Now, the Liberal Party is not always for giving out consumption vouchers, but then because we encourage people to work hard to make a living, but then now, for the retail sector, they do not have any subsidy, and because of the evening dine-in ban, there all retail outlets are so quiet. Now, the LP is for another round of the scheme, but some political parties against that. Will you still go ahead, even though there are objections? FS. Once again, I'd like to thank members of this council from different parties and groups for giving us their support in the consumption voucher scheme. They also went to the community so that we can come into contact directly with members of the public and merchants to promote the scheme. Now, we have spent about $30 billion in this scheme. Some of the view that this is too much, and perhaps we should target at the most needy groups instead. But then, last year, the pandemic has affected all sectors. It has caused some financial burden on many people, and then we needed the scheme to boost the economy. While there are still diverse views this year, we maintain an open mind. There will be a dynamic assessment of the situation. Now, if you look at the economic situation, if not for the current wave of outbreak, the underlying factors of the economy have been good. But then, at this stage, the SL government has to take a very stringent social distancing measures, hoping to cut the transmission chains as soon as possible. We need to observe the situation further and make appropriate response to the situation. Mr. Tommy Zhang. Thank you, President. FS. Last year, you were very commendable. Now, whether we talk about a cash payout schemes and the consumption voucher scheme, there was input from the Liberal Party. Last year, you accepted our proposal. You said that we helped you to promote the scheme. In fact, you're helping us. The catering industry has benefited from this multiplying effect. Now, in some eateries, if you spend $1,000, we top it up to $1,300. So the effect was excellent. Now, however, when it comes to the last paragraph of your reply, you said that the scheme had achieved your expectations. In fact, it has far exceeded our expectations, both yours and mine. Now, may I urge you to have another round of consumption voucher scheme. Mr. Tommy Zhang, please refrain from making opinions. Come to your question, please. Now, this is the 25th anniversary of the founding of the SAR. And then you should also boost the vaccination rate. So can you give another round of consumption voucher so as to celebrate the 25th anniversary of the handover, to boost the vaccination rate and to boost the economy? Thank you. As I said, we maintain an open mind. We will assess the situation dynamically. Stage, we will be all ears to views and will consider further. Mr. Jeffrey Lam, the multiplying effect of the $5,000 of consumption voucher was for all to see. This year is the 25th anniversary of the reunification of Hong Kong with the motherland. And BPA feels that it is the best time to give a $10,000 of a consumption voucher for celebration of the reunification of the motherland. I thank Mr. Tommy Zhang for suggesting that, so that members of the public can have a better sense of happiness, and that can also help recovery of the economy. So will you consider the aspirations of the community and different sectors? Can you give out $10,000 of consumption voucher before the 1st of July so that we can have more harmony in society and we can all celebrate the 25th anniversary of the reunification happily? Thank you. As I said, I maintain an open mind. We will continue to assess the situation. During the consultation period, I've got different views from members of the public, not just about whether the scheme should be reintroduced, but also on whether more store value facility operators should be included. Last year, the scheme has been well received because there was competition among different stored value facility operators. And of course, merchants provided different additional benefits to stimulate people's consumption sentiment. So we should be more thorough. We may not have a direct repetition of last year's scheme, not necessarily, and that's the thinking of the SAR government currently. Mr. Holden Chow, I'm sure the scheme will help. The Anti-Epidemic Fund 5.0 was launched. There was $1,000 for cleansing workers and also security guards in previous rounds, but there's not given in this round. My question is about the consumption voucher. You should really be eager for what the public want. You should provide at least $5,000 of consumption voucher. By the time it is dispersed, the economy or the pandemic will be well under control, and then you can boost people's spending sentiment, and we can revive the economy. FS, thank you. It takes time to prepare for the scheme, and we have to assess the situation in society because during the pandemic, I've heard views that given the very strict social distancing measures, consumption vouchers may not be used, even if they are given. And in as regards relief measures for SMEs and 100% guarantee loan scheme, and also paying interest break for loans. Now there are various measures, and they should be considered as a whole. I set a lot of store by members' views, but we have to strike a balance, overall speaking. Mr. Horace Cheung. Mr. Horace Cheung. The FS in his main reply mentioned that in considering whether another round of consumption voucher or giving of cash should be considered, he will consider the social and economic situation, the impacts on social livelihood arising from the outbreaks of the pandemic, and also the current financial situation, and that is he has the interest of the whole community in mind. So the FS is considering whether there should be consumption vouchers or a cash payout. I'd like to know whether he has other even better alternatives in mind now. FS. During public consultation, views were diverse. So we are listening to views with a humble mind, and then within the administration, we are making very detailed analysis and assessment. I'm afraid at this moment I cannot disclose details. If members have other suggestions, do let us know, and we will consider them very carefully and humbly. Thank you. Mr. Yim Kong. Thank you, President. FS. Different sectors of the community have a positive attitude when it comes to another round of consumption voucher. Now, there are many people in Hong Kong which have worked and paid taxes for a long time, and they are not yet permanent residents. Should you have another round of consumption voucher, will you, including this group of our community, for instance, if they are paying a certain level of tax, they can be included in your scheme? Can that be considered? Thank you, Mr. Yim Kong, for your question. In reviewing the consumption voucher scheme, we have also heard this view. Now, the eligibility criteria of the scheme is for those who are over 18 and also permanent residents of Hong Kong. That's an objective criterion, and we also took into account our financial affordability and also the management aspect. Thank you.
Question number 2, Mr. Yang Wing Kit. President, thank you. At present, the public hospitals in Wong Tai Sin district do not provide A&E services, and the authority has no plan to provide A&E services in Our Lady of Marino Hospital, or OLMH, upon redevelopment. As such, patients calling ambulance service in Wong Tai Sin will mainly be sent to hospitals outside the district, such as QEH or Kwong Wah Hospital or United Christian or the new acute hospital at Kai Tak. Some people are worried that the long traveling time may lead to delays in treatment. Will government inform this council, one, of the number of patients who boarded an ambulance in Wong Tai Sin and the average time taken from boarding the ambulance to arrival at the A&E departments in each of the past 3 years? 2, what are well-coordinated services of OLMH and the TWGH Wong Tai Sin Hospital, so that the two hospitals can provide more comprehensive specialist services and 24-hour A&E services? If so, of the details. If not, why not? 3, given that upon the completion of the new acute hospital, most of the services of QEH will be relocated there, and the original site will be used for medical purposes, whether the relevant purposes include A&E and specialist services? If so, of the details. If not, why not? Secretary for Food and Health. My reply to various parts of the question is as follows. 1. According to the information provided by the Fire Services Department, in relation to ambulance service in Wong Tai Sin, the number of patients who boarded FSD's ambulances in Wong Tai Sin in 2019-2021 were 38,429, 21,073, and 36,497 respectively. The average time it took for patients boarding the ambulance to arrival 22 minutes and 41 seconds, 21 minutes and 29 seconds, and 22 minutes and 54 seconds respectively. The HA plans and develops public healthcare services and facilities on a cluster basis, taking into account a number of factors, including supply and demand, the role of hospitals, the development plan of the hospitals, as well as coordination of facilities. This is to ensure that all hospitals within the cluster can perform according to their defined roles and provide appropriate health care. To cater for the overall healthcare demand in the next 10-20 years, the government and HA have commenced the first 10-year hospital development plan, or HDP, since 2019. $200 billion has been earmarked for a total of 16 projects to provide over 6,000 additional beds and 94 additional OTs, as well as to increase service capacity of specialist outpatient clinics and general outpatient clinics. The government subsequently announced in the 2018 policy address that the HA has been invited to start planning for the second 10-year HDP. The Kowloon Central Cluster, or KCC, where Wong Tai Sin belongs, currently comprises 9 hospitals or institutions, including QEH and Kwong Wah Hospital, which come with A&E departments. The HA has set the development direction of healthcare services in Wong Tai Sin in accordance with the clinical services plan. The Tung Wah group of hospital, Wong Tai Sin Hospital, has been identified as an extended care hospital and a TB and chest institution, providing transdisciplinary rehabilitative training that enable patients to reintegrate into society. As for OLMH, it is a community hospital that mainly serves the Wong Tai Sin residents and provides non-emergency services. The redevelopment of OLMH has been included in the first 10-year HDP, and the preparatory work has commenced since September 2018. The HA plans to seek funding from the FC within the current session to carry out the main works of redevelopment. Subject to funding approval, the main works will commence and are expected to be completed in 2027 at the earliest. Upon redevelopment, the number of hospital beds will increase from 236 to 437. Apart from inpatient services such as medicine, geriatric surgery, gynecology, orthopedics, and palliative care, a new hemodialysis center will be established, providing 16-day beds. The day surgery center will be equipped with 4 OTs that meet current standards. The planning for healthcare and facilities should take into account a number of factors, including the supply and demand, the roles of development plans of different hospitals, as well as coordination. A number of related facilities, including diagnostic radiology, OT, ICU, clinical laboratory services, are required for setting up an A&E department in a hospital. Constrained by site area and topography, the Wong Tai Sin Hospital and OLMH are not suitable to be converted into acute hospitals. Based on the recommendation of the Clinical Services Plan for KCC, the A&E service in Wong Tai Sin will be provided by the new acute hospital, or NAH, in Kai Tak under the first 10-year HDP. The NAH will provide 2,400 inpatient beds and other medical and supporting facilities. The NAH is located in the heart of Kowloon and will form a service network with WTSH, OLMH, and the Buddhist Hospital to provide comprehensive healthcare services to residents of Wong Tai Sin. The government understands the public's aspiration for A&E service. However, A&E service should mainly be used to handle urgent or serious trauma or severe illness and should not be used as a substitute for primary care service. Treating A&E service as such will not only overload public hospitals and prolong waiting time, it may also prevent people with genuine need from receiving timely and suitable A&E care. The government will continue to strengthen and reform primary health care services so that citizens in need can access primary medical services without having to rely on A&E services in public hospitals. The government will set out our ideas and plans in the primary healthcare blueprint later. 3. Upon completion, the NAH in the Kai Tak development area, most of the services of QEH, including A&E service, will be relocated there. And the ambulatory care center extension at QEH will be retained. At that time, QEH's current site in Kings Park will free up space for the construction of new healthcare facilities. Such project has also been included in the second 10-year HDP. Having regard to the completion date of the NAH, the HA will commence the development plan of the Kings Park site in a timely manner based on the service demand projections and in line with the timetable of the second 10-year HDP. Mr. Yang Wing-kit, President, the Secretary said the average time taken is 22 minutes for conveyance of patients to the A&E, but in Kowloon City and Wong Tai Sin, the roads are always congested and normally would take more than 40 minutes. Now, if we do not contemplate coordinating the services of the 2 hospitals in Wong Tai Sin, then you are really giving the patients a short shrift. Now, these 2 hospitals are in the vicinity. Why don't you form these hospitals into a cluster to make available the services? Secretary. President, as I said, the HA has always been looking into this. But for these 2 hospitals, Wong Tai Sin Hospital and the OLMH, if A&E services have to be provided, they will need a whole host of support services. Also, we have to bear in mind the topography, and they're not suitable for A&E services. In the KCC, Kowloon Central Cluster, these 2 hospitals have their own positioning. At this present moment, this is the current development plan. But we have to understand that there is some particular demand on the part of Wong Tai Sin residents. And we have a Kwong Wah Hospital and the United Christian Hospital. Now, we're not taking into account the new acute hospital in Kai Tak. Those two hospitals are upgrading their A&E services in the coming 2 years. The A&E services will be available, and the hospital beds will also be available. In the short term, we have already implemented short-term and medium-term improvements in Wong Tai Sin. That the family medicine clinic in OLMH do provide nighttime and public holiday services. At the general outpatient clinics, we have recruited additional manpower and also carried out retrofitting work in order to improve the environment for the patients and increase the number of consultation rooms. In 2012 to 13 to 1920, we have increased the number of services of an additional 600,000 people. Mr. Vincent Ching, the Secretary, said that upon completion of the Kai Tak Hospital, most of the QEH services will be relocated there. For Kowloon West, Mitaika, Kowloon City, and Yau Chin Mong, we're very worried because the QEH is really overburdened. Of the 17 public hospitals, QEH takes on the highest demand. Now, with the relocation of QEH to Kai Tak, how are you going to handle the vacuum period? Will there be any seamless transition? You may say that Kwong Wah Hospital can cater for that. The people hope that the A&E services will continue. Will you give the undertaking that the Kings Park site will retain A&E service? Secretary. Thanks very much, Mr. Ching, for the question. For Queen Elizabeth Hospital and the development there, and also the NAH, indeed, we will upgrade Kwong Wah Hospital. The number of beds and A&E services are subject to a timetable. We'll try to cater for the situation. Now, for QEH, we do appreciate members of the public's aspiration. As I said, this has been incorporated into the second 10-year HDP. In accordance with the completion time of the new A&E services, we will try to tie in with the second 10-year hospital development plan and commence the overall development plan for the Kings Park site. Mr. Lee, President, the Secretary must be aware that the DAB has been seeking for A&E services at the QLMH. We have been expressing this aspiration. Mr. Yang raised this point as a new member here. I think it goes to show that residents in Wong Tai Sin do have a very strong aspiration for an A&E department in the district. This has not been taken on board by the administration. I hope that you will appreciate the aspiration. Why is it that they are so insistent on that? President, for Kowloon Central residents, they don't have an A&E department. Also, ENT service, they have the longest period of waiting, 3 years in Kowloon Central, not so much in other districts. They may wait for 1 or 2 years. Secretary, you have to fight the epidemic, and you are very busy, and you've been here all morning addressing the questions. Now, for Kowloon Central cluster, in terms of ENT service, which has a very long waiting time, will you do something about it? I don't think it's fair to have this disproportionately long waiting time. I think we have to narrow the gap. Will you instruct the HA to review this situation and come up with a report for you to be made available to us? Secretary, thanks very much, Madam Lee, for the question. The waiting time which is long for different specialist disciplines. Indeed, this is something of concern to the HA and ourselves. I've already instructed the HA to make improvement regarding the waiting time for different specialist services. And work is in hand currently. Obviously, at this point in time, I don't have any information on ENT in KCC, but to shorten the waiting time, there is a need to increase the manpower. I'm grateful to LegCo's support for the doctor's registration amendment ordinance. We will be increasing the number of non-locally trained doctors, and we hope that we can shorten the waiting time for different disciplines. Now, it is challenging for different specialist care because we may not have that many doctors in various specialist disciplines. So the HA has to consider various methods like PPP and also specialist training for disciplines that are particularly acute, and they certainly would do that. Third, in terms of manpower, other than increasing the manpower, reducing the turnover is another measure. You may notice that the HA has launched a number of measures like promotion and so on in order to retain the necessary manpower. We certainly will make sure that the HA will try to shorten the waiting time as much as possible for the specialist care. And also, we do have the primary healthcare blueprint, and we will deal with the more straightforward cases in the community without people having to turn up at the specialist clinic, and work is in hand there. Ms. Yan Chen, President, the A&E services in Wong Tai Sin, this is a problem for so many years. We've been discussing this here in this council many times. We have the highest proportion of senior citizens in Wong Tai Sin. They may be chronically ill, and they may suffer from falls and urgent conditions. Now, you mentioned that there are 9 hospitals in the KCC. Now, QEH and Kwong Wah hospitals do come with A&E services. You may wish to go and do a poll there in Wong Tai Sin. How many of them would consider QEH and Kwong Wah hospitals as part of Wong Tai Sin? They are in Yau Chin Mong. They may belong to KCC, but we're asking about the Wong Tai Sin district, and this is one of the 18 administrative districts. We have been deprived of an A&E service. Now, Secretary, you mentioned the site constraint, the topography, and so on. OLMH, the Buddhist hospital and Wong Tai Sin hospital are not suitable for A&E service. Have you considered this, Madam Secretary? Will you be identifying alternative plan for a hospital, a comprehensive hospital to be built in Wong Tai Sin to address the aspirations of the Wong Tai Sin residents? Secretary, thanks very much for the question. Now, for Wong Tai Sin residents and their aspiration for medical care, we have been very concerned. We have been making improvements indeed. As I said, in terms of medical services, we have to have regard to the supply and demand in the entire cluster and the positioning of different hospitals and a long-term development plan. All this would go hand in hand. In the HA, we do have the cluster mechanism for different districts. Also, in the 18 districts, we are making available the services on this basis. Now, for KCC, Kowloon Central Cluster, according to the clinical services plan, we have the new acute hospital in the first 10-year development plan to make available services. We have 2,400 beds in this regard, but it doesn't mean to say that we're not doing anything at all in this at this present moment. For the medium and long term, other than the Kwong Wah Hospital and QEH, we also have the United Christian Hospital we are aware that the new acute hospital in Kai Tak, which has already been commissioned, the A&E services will become available later on. Now, for the reconstruction of the UCH and another hospital, they are tying in with this development. Now, in Wong Tai Sin, there is a keen demand for general outpatient service also. So we have been trying to tie in with that and increasing the availability of services. Well, the Secretary has already addressed your question. If you're not happy, you can take it up again on other occasion. Mr. Edmund Wong, President, I agree that the acute A&E hospital is not a substitute for primary health care. In Wong Tai Sin, it has a higher proportion of senior citizens, and there is a population of 420,000, and there is a keen demand for A&E services. If OLMH cannot provide 24-hour A&E service, will the Secretary consider providing 24-hour outpatient service for OLMH? And it does have the gynecology service, although it doesn't have any pediatric. I think that the patients can be admitted to the OLMH direct without having to use the ambulance. This 24-hour outpatient service will certainly meet the needs of the residents. It would also assuage the demand for Cat 3 and Cat 4 services and QEH. Will you consider providing 24-hour outpatient service at OLMH? Secretary. Thanks very much, Mr. Wong. Now, for OLMH, the Robert Black Clinic do provide nighttime outpatient service. Now, the HA did consider that. Now, in terms of 24-hour outpatient clinic service, the patients should go to the A&E service if they are in emergency situations instead of outpatient clinic.
Question 3. Honorable Lok Chung Hong. Mr. President, some taxi owners have relayed that they have all along been facing the problems of difficulties in taking out insurance policies and high insurance premiums. Earlier on, an insurance company which provided insurance services for about 10,000 taxis suddenly issued notices on termination of insurance policies to its taxi insurance policy holders, almost causing 10,000 taxis to cease operation. Subsequently, the Insurance Authority, IA, invoked the powers under the Insurance Ordinance to appoint managers to take full control of the affairs and property of the insurance company concerned. The managers revoked such notices immediately afterwards, and the issue was settled temporarily. In this connection, will the government inform this council first whether it will conduct a study on the issues of taxi owners taking out insurance so as to completely resolve the problem of difficulties in taking out insurance policies and high insurance premiums? Second, whether the authorities have conducted investigations into whether the insurance company concerned violated the relevant legislation or guidelines issued by IA. If so, of the details and how the authorities will hold the company responsible. And third, whether it will improve the existing notification mechanism for termination of taxi insurance policies by extending the notice period for termination of insurance from 7 days currently to 1 month. Secretary for Transport and Housing. Thank you, President. In consultation with the Financial Services and the Treasury Bureau, FSTB and the Insurance Authority, IA, my reply is as follows. First, as regards taxi insurance, like other motor insurance businesses, insurers underwrite and determine premium level based on commercial principles, taking into account factors such as accident rates, accident severity, past claim records, etc. In recent years, there has been an increase in taxi accident rate. The business environment of the taxi insurance industry has been unsatisfactory, and taxi insurance premiums have risen. The government understands the taxi trade's concerns about insurance matters and has been maintaining close communication with the taxi insurance trade in this regard. The Joint Subcommittee on Issues Relating to Insurance Coverage for the Transport Sector subcommittee was set up in the last term of the Legislative Council to explore and discuss the problems encountered by the transport sector in procuring insurance and to make recommendations to tackle such problems. At present, the government is actively following up on the recommendations of the subcommittee. The IA notes that currently some insurers have adopted measures to enhance risk differentiation in order to facilitate more accurate and underwriting decisions and setting of premium for individual policies. Such measures include deducting the excess for policyholders who can provide video footage of the accident at the time of claim application and offering discount on premiums to policyholders who can provide specified information concerning the drivers, including the traffic offense records of the drivers at the time of application. In addition, with the coordination of the FSTB and the IA, the Motor Insurers Bureau has suspended the levies on motor insurance for a year with effect from the 1st of October 2021, equivalent to 3% of the gross premiums of policies, so as to alleviate the financial burden of the public amidst the impact of the COVID-19 epidemic. This measure will directly reduce the cost of motor insurance and benefit various transport sectors, including the taxi trade. The government has all along been highly concerned about the problems encountered by the taxi trade when taking out insurance, which are not only related to insurance but also to the overall taxi operation and management. The government is reviewing and will submit a host of measures to improve the development of the taxi industry, which include exploring how to enhance taxi service quality through professional fleet management, so as to provide better service to passengers. We also aim to provide passengers with better protection through introduction of the taxi driver offense point system, increasing penalties for illegal carriage of passengers for hire or reward by motor vehicles. The government will consult the Legislative Panel on Transport on the relevant suggestions later. According to the understanding of the Transport Department, the taxi trade is exploring various measures to reduce traffic accidents, which include requiring rentee taxi drivers to provide certificates of previous conviction to taxi operators, centralizing the management through fleet operation, and strengthening driver training. The taxi trade is also participating in the testing of various anti-collision warning, lane keeping warning devices that could monitor drivers' condition and driving behavior. The TD will continue to follow up closely with the trade on the testing progress and effectiveness with a view to identifying suitable safety devices to be installed on taxis. The TD will also continue to work with the police to enhance drivers' awareness of driving safety through various measures like regulation, enforcement, publicity, and education, etc. Second, the IA is an independent regulatory body established under the Insurance Ordinance, Cap 41 IO for short. Pursuant to the IA performs statutory supervisory functions, which include requiring insurers to consistently maintain sufficient solvency for the promotion of stable development of the insurance industry as well as protection of existing and potential policy holders. Through its supervisory work and the market intelligence collected, the IA discovered that the investment activities and asset allocation of Target Insurance Company Limited might have breached the statutory requirements under the IO, and they were also suspected deficiencies in its corporate governance. The IA thus decided to exercise its power to appoint Deloitte Touche Tohmatsu on the 7th of January 2022 to take control of the affairs and assets of the company to ensure its normal operation and conduct a detailed assessment of its financial position. The IA will, upon analysis and examination of all the evidence, decide on the way forward, including taking action against any illegal acts or misconduct in accordance with the law. Third, an insurance policy is a commercial contract under which both the policyholder and the insurer are entitled to terminate the policy in accordance with the relevant provisions of the contract. Prevailing third-party risk insurance policies for motor vehicles, including taxis, generally require a notice period of 7 days for policy termination. This arrangement aims to provide convenience to policyholders who decided to sell off their vehicles to recover the residual premiums as early as possible. The government and IA welcome the views of the stakeholders and will discuss with the insurance industry on how to improve the arrangement. Honourable Michael Look. Madam Deputy, regarding taxi insurance, I think it shows the problems in the taxi trade. There is inconsistency in their standards. There is a small group of misbehaving taxi drivers, just a handful of them, affecting the image of the industry, affecting the entire trade. Other law-abiding taxi drivers and owners found it difficult to procure insurance and have to pay a high level of premium. It is said that the government will actively follow up on the recommendations of the Joint Subcommittee on issues relating to insurance coverage for the transport sector. We know that we have to rely on IT, big data, etc., to improve the assessment of risk. In particular, for the FTU, when we discuss the bill on franchised taxis, we need to have an employer-employee relationship so as to change the ecosystem, the habitat of the taxi industry. This will enhance the service quality. In relation to such recommendations, is there a timetable to carry out follow-up work? In particular, in relation to franchised taxis, are you going to have taxi fleets having an employer-employee relationship with their drivers? Secretary. Thank you, Madam Deputy. Thank you, Mr. Look, for his follow-up question. For the operation of the taxi industry and its challenges, I think we are all aware of them. As to how we are going to help the taxi industry to enhance its safety, its service quality, as well as the long-term healthy development, well, first of all, in my main reply, I have already given a very detailed account in relation to the management of taxi fleets. We did have communication with the taxi industry, and employer-employee relationship is part of the proposals. We have got 18,000 taxis. We don't need all the taxis to be managed in the format of taxi fleets, but this is indeed a possible direction of development. We have black sheep. There are also insurance frauds, and we have carried out law enforcement action to deal with that. We are moving on with our study. As I have said, later on, we are going to consult the views of the electrical panel on transport. We do welcome your advice and suggestions, and I'm sure if you have time, we can have a meeting and we can have a word. Mr. Look, I think the Secretary has answered your question. Please take your seat. Mr. Chen Chen-ying. Well, the insurer involved has 60% of the market share. Suddenly, the taxi owners were surprised by the termination notice. Most of them were not able to get insurance coverage within the 7-day notice period. Luckily, the IA has taken over the insurer, and the termination notice has been withdrawn. I think it is just a matter of delaying the problem and delaying the risks. I think we need to avoid a recurrence of such a matter. I think the government should consider whether we should avoid having over-concentration of the insurance business. Say, for example, imposing a cap on the market share of the insurers in relation to such motor insurance businesses. Secretary, allow me to answer the question on behalf of the FSTB. Well, Mr. Chen's question is in relation to insurance business. I think we need to respect the market operations. I think in Mr. Chen's question, the point is that a single insurer has taken up a lion's share of the market. But then we need to look at the details of this case. We are talking about an insurer incurring problems in its operation. Otherwise, we would not have invoked the very exceptional powers under the IO. That is, we are appointing a accountancy firm as its manager, so as to take over the business on behalf of the IA, so as to follow up on all the issues. So there are 2 points here. First of all, if there's fair competition in the market, and then individual insurers should be respected in gaining their respective market share. But then, of course, in relation to insurance policies for taxis, we do have exceptional powers, and we can follow up on insurance policies that might have been terminated, and we can also make arrangements for other insurers to take over the policies as a result of the failure of Target Insurance Company Limited to carry on with the insurance service. In other words, other insurers can also take over the insurance policies. Mr. Chan Kim Po, there are dozens of insurers having the capacity to provide motor insurance, but in the market there are just a dozen of them that are willing to do so. This is because the insurers have suffered losses, high accident rates, insurance frauds, as well as tragedies. The administration has talked about prevention of traffic accidents, but what about insurance frauds as well as tragedies? What are your countermeasures? SH, regarding insurance fraud as well as tragedies, we have to count on the police to enforce the law. We'll also liaise closely with the trade, because we're talking about criminal offenses, and this goes beyond insurance and taxi business. But in any event, we do take a very serious view. We do hope that when we talk to the taxi trade, first of all, when they hire a taxi driver, they should first of all consider the taxi driver's previous criminal record. They should also look at their traffic offense records. So it is hoped that they will get somebody who has a reliable record, a good service attitude, and who are of good character and a man of integrity. And in this way, we can provide quality service to the citizens, and there will be safeguards. Of course, we understand that the problems are present in the other sectors of the insurance industry. We'll ask the IA to follow up. Mr. Frankie Yik. Thank you, Madam Deputy. In relation to the termination of policies, I think it has caused a shock wave to the taxi industry. Everybody was living in fear. I spent my entire holiday liaising between the IA and the trade and the insurers. In today's world, it is very difficult to get a replacement insurer in 7 days. In fact, the insurer only sent registered mail to the policyholders, many of whom are not living in Hong Kong, and so many taxi drivers and taxi owners had their taxis on the road without insurance coverage. It was indeed a very serious problem. Well, last week at the Q&A session of the CE, I made proposals on 2 fronts. First of all, as Mr. Michael Look has mentioned, instead of giving a 7-day notice period, there should be 30 days. Secondly, maybe we should empower the IA. That is, when the IA spots that this is likely to happen again, then the IA should move quickly instead of being caught by surprise and not sure what to do. So will the Bureau consider my second proposal? And in fact, you always have to pay a higher premium when you change your insurer. So I want to know, when are you going to allow the taxi fares to be increased? STH. Let me answer the second part of Mr. Frankie Yick's question, and then I will invite Mr. Yao to take up the first part of his question. In relation to taxi fare increase, well, the taxi trade has already made an application as a result of the Black Riot in 2019, as well as the pandemic. We have to start afresh with our gathering of information. We would like to deal with the procedures as quickly as possible. And when we are ready, we'll go to the EXCO as well as the LegCo to seek their support. Mr. Chen Pulang. Sorry, Madam Deputy. Sorry, Mr. Chen. A moment, please. Mr. Yao, please. SED. Let me answer the other part of Mr. Frankie Yick's question. I think we've all noticed that when a policy is terminated, well, the general practice in the insurance industry is to give a 7-day notice. Is it possible to come up with a longer notice period unilaterally? Well, we noticed the recommendation, but then it is, after all, a commercial contract. It must have the agreement of both the insured and the insurance policyholder as well as the insurer. Generally speaking, it is a 7-day notice period. Of course, we are talking about an exceptional case. If an insurer is acting irresponsibly or there is any breach of regulations, we can deal with it in some other ways. Should we be changing the terms and conditions of the insurance policy, jeopardizing the interests of the insurer and the policyholder? We have to think carefully. Well, as Mr. Chen has said, we are going to review the entire taxi industry. The views gathered by us would also be referred to the IA. Mr. Chen Pulang. Thank you, Madam Deputy. The Secretary talked about various improvement measures. They have been talked about for a long time. We haven't got an implementation timetable. Are you going to mandate the changes? Are you going to introduce a bill so as to have a smart monitoring device, speed limiter, as well as a central database for taxi drivers so as to enhance qualities of the service and enhance the safety of the driver's behavior? Secretary, indeed, use of IT is part of our mechanism to make improvements. As I have said, we can have some recording devices so as to capture the driving behavior. And then in this way, we can avoid frequent lane changing. We can also detect the driver's condition and issue timely reminders. And of course, at the time of procuring insurance, we can make reference to the claim history of the relevant drivers. If this is available, there will be a check and balance mechanism. I'm sure the industry would also want to take the initiative to do this. On the part of taxi drivers, they would also like to have such information so as to lower the costs of hiring the taxi. I'm sure the government, the taxi trade, and the insurance industry can cooperate, and then we can avoid resorting to the legislative means. We should only have it as the last resort when all other measures fail. But currently, I do hope that, as I have said, we would like to have a set of measures that can achieve the target without resorting to a legislative means. Mr. Tan Ka Pio. Sorry, Mr. Chen Hangban. Madam Deputy. No. Mr. Tan Ka Pio, I'm sorry. Madam Deputy, I think the government lacks the dedication to improve the taxi trade. I think it is a commonly shared opinion. So what about being more active in monitoring the taxi trade as well as the insurance company? For a long time, you allow an insurer to take up more than half of the market share. Is it against the principles of competition? You can only ask one question. Mr. Tang, let me remind you, you can only ask one supplementary question. Please stop. Sorry, speaker is off mic. Let me remind members, for the supplementary questions, you can only ask one supplementary question. Mr. Yao, would it be your turn to take the supplementary question? Well, in relation to this particular case, we have got a particular company taking up a lion's share of the market. He would not like to know whether it is against the principles of competition. The answer is no. Whether there is a breach of the competition laws, it is not dependent upon the market share. It's a matter of whether there has been collusion, whether there has been price setting resulting from collusion. If there is a choice, then it is not against the competition ordinance. As other members have said, in Hong Kong, in fact, we have got dozens of insurers that can take up the business. But of course, we have to make a distinction here. That is, in this case, indeed, there is an insurer that is suspected of having broken the law. So the government has resorted to exceptional means to take over it. Now, please ask other questions on other forums.
多謝主席。
The Honourable Yu Pak-lau. Thank you, Madam Deputy. Some practitioners of the tourism industry have relayed that the industry has been hard hit by the coronavirus disease 2019 epidemic. Although the Chief Executive has recently announced the launch of the fifth round measures under the anti-epidemic fund to assist those industries affected by the epidemic, such measures are just a drop in the bucket to the tourism industry. The industry hopes that the government will conduct policy planning and provide continuous support for the industry in a systematic manner so as to expand the room for business for the industry as far as possible. In this connection, will the government inform this council, one, given that the government has again tightened anti-epidemic measures and the various tourism-related activities have to be suspended, causing the industry to suffer heavy losses, whether the government will draw up criteria for the expeditious resumption upon easing of the epidemic situation of tourism activities such as local tours, cruise to nowhere travel, and free tour programs. So, if the details, if not the reasons for that, be whether it will, by drawing reference from the earlier practice of offering short-term jobs to tourism practitioners, consider creating temporary posts related to anti-epidemic work or guided tours for local hotspots for frontline tourism practitioners who are underemployed so as to retain talents for the tourism industry. If so, of the details, if not the reasons for that. Secretary for Commerce and Economic Development. Madam Deputy, I thank Mr. Yu for his question. Coronavirus has been rampant all over the world, and inbound and outbound tourism have almost come to stagnation. We understand that the industry has been hard hit, and we've been helping the industry in various ways and forms. Faced with the very difficult operating environment, the government has launched a financial commitment of up to $342 billion for the sector. And then under the principles of prevention and fighting a disease, we try to create room for operation for the sector, and we have got a series of measures to support the industry, allowing the two theme parks to resume operation, and we allow local tours and cruise to nowhere to be operated with conditions, and we've gradually relaxed the number of visitors allowed into the theme parks. The Tourism Board has also launched a fifth round of holiday at home and also staycation at home to encourage local consumption in tourism. And Hong Kong, we also expanded the Green Lifestyle Local Tour Incentive Scheme so as to launch more tourism products and initiatives to promote local tourism. As for subsidy, taking into account the latest round of measures to support the industry through the AEF, the administration has provided the sixth round of funding scheme for supporting the tourism industry. And the government has also, through the travel agent incentive scheme and boosting the Green Lifestyle Local Tour Incentive Scheme, provided support to the industry. In response to Mr. Yu's question, because of the latest development of the pandemic, the government announced on the 5th of January and subsequently on the 7th of January that social distancing measures should be tightened. On the 14th of January, the measures were extended until the 3rd of February so as to contain the current round of outbreak. And some tourism facilities activities such as theme park and cruise to nowhere and local tours have inevitably have to be closed. On the 14th of January, the chief executive announced a new round of AEF and $370 million in the 6th round of subsidy to the tourism industry to help the industry, and then another $300 million are for the Green Lifestyle Local Tour Incentive Scheme extension. As I said, in supporting the industry, the government has been encouraging and assisting the sector to develop and expand its market, in particular, before the resumption of inbound local tours. They should develop the local market, and we are pleased to see that the Green Lifestyle Local Tour Incentive Scheme have been well received by the sector and also the public. The number of travel agents stood at 700 at the end of last year, accounting for close to half of the licensed travel agents. So you can see that the scheme has been well received and the subsidy amount is nearing the ceiling of 100 million. And then the government announced that another $300 million would be injected into the scheme to address the aspirations of the sector and to provide opportunities for the sector. Of course, the government hopes that by the time the epidemic eases, the sector can resume its business ASAP. As regards when and how, I'm sure members understand it depends on the management and situation of the scheme. Now, the second part of the question, in order to provide relief to unemployment related to the pandemic and also the control measures, in 2020 and 2021, the government created time-limited posts under AEF, and in the second round of job creation scheme, 1,900 practitioners in the tourism industry were employed to work at community vaccination centers and vaccination posts and stations at public hospitals and mobile stations to provide management and administrative support. Will continue to make available such job opportunities as they arise. And then through our support to the local scheme, we're providing more jobs directly to the practitioners. We understand that what the industry wants most is that when the epidemic stabilizes, to reopen the borders with the mainland Macau and then gradually with other economies. I believe that when cross-boundary travel resumes, there will be change in the traveling pattern of tourists. Tourists will have to take into account more factors, including the pandemic situation, the risks, and also the requirements for testing and quarantine. And that will add to the traveling costs. I'm sure we will face a very fierce competition for tourists. When we compete with other tourist destinations, we must provide more diversified and quality traveling experience. We have got the blueprint for development of the tourism industry by means of cultural tourism, heritage tourism, and green tourism. We can add new products and initiatives. We'll continue through the tourism industry and tourism board discuss with the sector so that we can have more measures to enhance the capability and confidence of the sector. I'm sure we'll be able to provide diversified jobs in the sector. In the long term, we can raise the quality of jobs and also retain talents, as suggested by Mr. Yeo. Thank you. Yes, the new round of AEF was launched very expeditiously. That is commendable. Many practitioners and travel agents have received SMS. I believe they'll be able to receive the subsidies before the Chinese New Year. So that is a very tiny help phase with the coming Lunar New Year. But that is just a drop in the motion. I'm sure 2022 will continue to be a difficult year for the sector. So my question for the sector is whether there can be more resources and more injection into the AEF, so there can be sustained support for the whole value chain or industry chain. And then for support tourists, tourists, coaches and MICE, and also other members of the sectors that have yet to benefit from this new round of AEF, can they be given timely support as well? Secretary, I think we all agree that the tourism industry, compared to other industries, have been in a very difficult situation for more than 2 years, not just because of the pandemic, but the black cloud violence as well. So the government has been more generous to this sector as a result. In my main reply, I said that we hope to make use of this opportunity. We may not be able to reverse the current stagnation of cross-boundary travel, but there can be ways to help the sector to keep afloat and to retain talents and to be prepared for the future revival. But then the tourism sector may involve other related sectors. They are not as hard hit. Now take the the hotel industry as an example. While they don't have any tourists, they can still continue to operate, and therefore the amount of support they receive from us may not be as much as other sectors in the industry. It's true that the tourism industry is in a very difficult situation. We have maintained good communication with the sector, and therefore we're able to give them support very expeditiously. As in the past 5 rounds, we were able to disperse the much needed support, financial support to the industry and its practitioners within the shortest possible of time. Mr. Lim Chong Sing. Now, many practitioners have already switched their trades, and even if the tourism industry is to recover in the future, we may not have enough talents. Will the government consider encouraging talents to take courses under qualification frameworks, and even to take examination for accreditation of their qualifications? Anyway, the administration has always encouraged people to obtain accreditation under the QF. So the government can give them some subsidy to give them financial relief, and we can encourage them to add value to themselves, and then we can retain talents for the industry. Secretary, I agree with Mr. Lam. I think the sector should take this opportunity to transform its mode of operation. After the epidemic has eased, when cross-boundary travel resumes, I think the traveling mode will be very different. People may not just start their trips lightly. They may have more considerations. So the market might be shrinking, and tourists are more demanding, and these are the challenges faced by the industry. Nurturing of talents is an important factor. In the short term, we cannot stop the practitioners from changing their trade. I agree that in the long term, qualifications framework and also retraining are opportunities. I believe the tourism industry was among the early sectors who joined the QF, because for tourism industry, we do not just rely on academic qualifications. When there is any need to upgrade their skills and knowledge, then the QF can help. I understand the Labor and Welfare Bureau is also concerned about the switching of jobs or trades in this sector. We will see whether we can do more. Mr. Tik Chi Yun. Mr. Yu said that there is some that there's drizzle in some sectors but none in others. Now we have a coach we have coaches, so-called A01 type of licenses. They serve tour groups. Many of them are SMEs or even sole operators. Now, when there is zero income, they have to spend more than $10,000 for insurance, license fees, and some are breadwinners. Many of them do not have savings. Some have found it difficult to take out loans, and some companies are close to winding up. In the first 3 rounds of AEF, they were taking care of those small-scale operators of coaches. But in the 4th and 5th round of AEF, they were left out. So, Secretary, can you discuss with this group of operators to help them tide over the very difficult period? Secretary. With regard to the question referred to by Mr. Tick, we have taken note of that. In every round of AEF, we gave our help in the light of the situation. Now, for this round, starting from the 7th of January, indeed, we have closed down quite a number of premises. But then the period of suspension of business is limited compared with what it was in the past few rounds. And we were able to launch the AEF very soon. For tourism-related sectors, every time we provide relief, we will take into account the current situation. In the last 2 rounds of support, we take care of coach drivers. But in the transport sector, I'm sure we understand that not all coach drivers are related to tourism. So the government will take into account a number of factors. For instance, in the last round of subsidy, there was some subsidy to cross-boundary bus drivers. We understand that we may not be able to satisfy the needs of each and every sector. We'd like to shorten this time of business suspension as far as possible to minimize the impact on the industry. Dr. Chow Man Kwong, because of the Black Cloud violence and the pandemic, we have suffered for more than 2 years. And the tourism industry cannot see their prospect for development in the medium and long term. I understand the government would like to consolidate resources here to support further development of the industry. I think this is welcome by the sector. So I'd like to ask whether the administration has consulted the trade on reorganization of government structure so that the restructuring can be more effective. Secretary, thank you. Dr. Chow, for your question. A few years back, there was a suggestion to set up a bureau for tourism. And then recently, people think that there should be a Tourism and Cultural Bureau. The course did not just come from the administration, but from the tourism industry as well. Now we encourage multi-destinations trips. We are discussing with the mainland in GBA, and in the mainland, they also consider culture and tourism together. In the last term of the council, I said that in GBA's planning framework, there is particular attention to the multiplying effects of culture and tourism. So whether it be from the cultural or tourism sector or the government, we all agree that cultural and tourism can be complementary to one another. In the past few years, in effect, we have used places like the WKCD West Kowloon Cultural District is being developed and commissioned. Whether we talk about cultural or historical culture, that is redevelopment of the Dr. Sun Yat-sen trail or local cultural characteristics and also arts initiatives such as installation art. So in local tourism in particular, we have incorporated elements of culture to enhance the attractiveness of these destinations. Ms. Carmen Ken, thank you. As mentioned by the CEO in last week's question session, she said that tourism was the one sector that had not recovered at all. In the past 2 years, the sector has been no operation at all, and I think they are near. They cannot keep afloat. So I'd like to know under what circumstances will the government consider setting up a fund for resumption of business for this sector. Secretary, thank you. As I mentioned in my main reply, in the past 2 years or so, we are giving support to the tourism industry through the AEF in the main, and then outside the AEF, through our subsidy to the Tourism Bureau, we have Tourism Board. We have launched the holiday in Hong Kong, staycation in Hong Kong, etc. We have also wired funds from other bureaus, such as funds from the Environment Bureau to run the Green Lifestyle Local Tour Incentive Scheme. Now, there have been 4 rounds of AEF, and yet the industry has received 6 rounds of financial support totaling $270 million. So some of the proposals are for the long-term development of the industry, so that we can help the industry to upgrade and transform themselves while there aren't tourists. And when the tourism revives, then we're at a better position. $340 billion have been put into this industry. There are a few members who would like to ask questions. Please follow up on other occasions.
Next question, Mr. Tony J. Thank you, Madam Deputy. The government has put forward the Northern Metropolis Development Strategy in the 2021 policy address with a view to driving Hong Kong's economic and innovation and technology development, increasing housing supply, and formulating a conservation policy. However, some members of the architectural surveying, town planning, and landscape sectors hold different views regarding the proposed 2,000-hectare conservation area. In this connection, the government informed this council, one, of the basis for the total area, site distribution, conservation proposals, etc., of the conservation area, and whether it will conduct further studies and make amendments in the light of the views of the sectors. 2, regarding the Sampo Shui Wetland Conservation Park, covering 520 hectares, some members of the sectors consider that some sites within the park have relatively low ecological conservation value, and incorporating them into the plan will affect the development potentials brought about by the existing and proposed MTR stations, as well as the Shenzhen Innovation and Technology Zone in the vicinity. Whether the government will review the planning so as to optimize the development potential. And 3, as some members of the sectors are worried that the planning and conservation studies of the Northern Metropolis will slow down or even halt the progress of the public and private development projects which are underway or pending approval, how will the government prevent such situations, and whether it will take measures to expedite the existing development projects in the district in order to increase the land and housing supply in the near future. Secretary for Environment. Madam Deputy, the CE announced in October last year the Northern Metropolis Development Strategy, which proposed for the first time to adopt a proactive conservation policy and to resume private fish ponds and wetlands with conservation value in Deep Bay, including Jinbei Zhui, Namsang Wai, Feng Lok Wai, Tai Sang Wai, Santin Sampo Shu, Hu Hok Wai, Shaling, and Lam Hang, and together with adjoining government land to establish a system of wetland conservation parks, or WCPs, to create environmental capacity so that Hong Kong can strike a balance between conservation and development and achieve coexistence of development and conservation. Our reply to the question is as follows. 1. The Northern Metropolis has diverse habitats, including large areas of wetlands such as fish ponds, marshes and mangroves, etc., whereas the Maipo and Inner Deep Bay area is an internationally important wetland under the Ramsar Convention. The wetlands in the Northern Metropolis are ecological environment which are priority areas for conservation in the GBA or even southern China. The strategy aims to adopt more proactive measures to protect the ecological value of these areas to build a comprehensive wetland conservation system. The wetland conservation system, as proposed, is estimated to have a total area of about 2,000 hectares, which includes the existing wetland park, 62 hectares, the Maipo Nature Reserve, 370 hectares, and the proposed 3 WCPs, i.e. Namsang Wai WCP, about 400 hectares, Sampo Shu WCP, about 520 hectares, and Hu Hok Wai WCP, about 300 hectares. The expansion of the wetland park, about 240 hectares, as well as the establishment of Shaling Lam Hang Nature Park, 4 hectares, and Jinbei Zhui Lao Fao Shan Pak Nai Coastal Protection Park, 145 hectares. These areas cover ecologically important fish ponds and marshes, which are internationally and regionally important foraging ground and habitat for migratory waterbirds. The development strategy is a conceptual plan. The locations and the estimated areas of the proposed WCPs are for illustrative purposes only and do not reflect the exact locations and areas. In order to determine the exact locations or areas and management model for the 3 WCPs, the Shaling Lam Hang Nature Park, and expansion of the wetland park, as well as to assess the effectiveness of the relevant measures in creating environmental capacity, the AFCD will launch a strategic feasibility study this year and consult stakeholders in due course. In addition, the Development Bureau will commence a feasibility study on the development potential of the Jinbei Zhui, Lao Fao Shan, and Pak Nai areas this year, while the Environment Bureau will in parallel explore the area to be reserved for the Coastal Protection Park. 2. Regarding the future development of the Sampo Shu area, the government is advancing the Santin Lok Ma Chau Development Node project and aim to commence the first batch of work in 2024. This node will mainly be for innovation and technology uses, and together with the Hong Kong Shenzhen Innovation and Technology Park in Lok Ma Chau Loop, it will form the Santin Technopole, which will generate a synergy with the Innovation and Technology Zone in Shenzhen, on the other side of the Shenzhen River. At the same time, the Sampo Shu area covers a large area of fish ponds and wetlands, providing foraging ground and habitat for migratory water birds and wildlife. It is an important part of the Deep Bay wetland ecosystem. The local fish pond operators there have also been conducting habitat management for years to provide foraging ground and habitat for water birds. The ecological value of fish fish ponds has been enhanced while preserving the local cultural heritage of traditional aquaculture. The proposed sample Xu WCP will be included in the AFCD's strategic feasibility study to be commenced this year. The government will strive for the coexistence of development and conservation in the northern metropolis, with a view to achieving sustainable development. 3. Regarding the WCP system, the government will conduct further studies to work out the exact locations and areas. The planning of a development project involves a project. Generally speaking, for development projects involving statutory planning procedures, even when the developer has obtained the planning permission from the TPB, it still needs to fulfill the approval conditions timely and commences development within a set time frame. For example, the development project's conservation and management plan, etc., must comply with all requirements and conditions imposed by the government in order to be considered having fulfilled the planning requirements. The development projects shall also comply with other statutory requirements. For instance, some projects will still need a statutory EIA in accordance with the EIA ordinance to demonstrate that the environmental impacts could fully comply with the requirements and obtain the environmental permit. Even though AFCD will commence a strategic feasibility study this year to work out the areas and management model, the private development project owners can still follow up on the planning requirements and approval conditions with the relevant departments. The AFCD's study will fully consider the impact on the overall function and operation of the WCP system arising from private development within the proposed WCP, which have fulfilled the relevant planning requirements or already been granted with planning permission in formulating the overall strategy. Regarding the development applications within the northern metropolis that have yet to obtain statutory planning approval or are newly received, they will be handled under the established mechanism, including being considered based on the existing statutory plans, the planning intention, the relevant planning considerations. Relevant departments will carefully consider the specific development proposals and conservation plans from different policy and technical perspectives, including whether they fulfill the policy intentions in development strategy, including the development of WCPs and wetland conservation, and provide comments to the TPB. Mr. Tony J. Secretaries, our sector is in support of the government's, in support of Hong Kong's development and conservation. And so for this Northern Metropolis Development Strategy, we pin very high hope on this. However, the sectors are concerned, as alluded to in my principal question, they are concerned whether the government will be slowing down in granting approval to the applications for development. In your reply, Mr. Secretary, you said that for applications for development, they will be handled in accordance with the established mechanism, and they will have to fulfill the policy intention. My question is, with regard to these policy intentions, the frontline officers may not be aware of them. How can you make sure that they will be in the loop to make sure that there will not be any slowdown in the development applications? Secretary. Well, let me address the part relating to my portfolio, and I see whether the Secretary for Development has got anything to add. The AFCD, as I said, will conduct a strategic feasibility study to look at the conservation of the ecology, and I'm sure that there will be proper communications between the departments, and they will have regard to the overall direction. Development Secretary. Madam Deputy, very simply, we do not spot any particular problems. If there are areas where conservation is the main direction, the departments will continue to handle the applications. That this is the usual practice, that we will consult the AFCD, and there will be proper communication with the AFCD. Mr. Edward Lau. Madam Deputy, the wetland conservation policy is really abandoning the sites to their own devices. 200 hectares have been lying fallow, and the government said that the wetland buffer area will be reviewed to release some of the land for conservation. Now, my question is, in the loop area, it is being developed into I and T zone. You have the Technopole and Sampo-Shu and Ho Hok Wai. They are surrounding the IT zone. Now, will the Secretary consider adopting my proposal by shifting the conservation area and also making compensation in order to release the in-between land for development, in order to step up the liaison between the two places, and that would enable a more comprehensive development overall. Secretary for Development. Thanks very much, Mr. Lau. For a wetland buffer zone, in answer to Mr. Lau's question earlier, this is something that we are looking at together with the Environmental Bureau. Now, we're not compromising the wetland integrity, and can we allow certain development? All these developments are not unconditional. There will be strings attached regarding the conservation. Later on this year, by the time we have the specific proposals, we will consult members. Professor La Chipang. Madam Deputy, the Northern Metropolis is an important undertaking for the future of Hong Kong in order to achieve coexistence of development and conservation. I'd like to put this to the secretaries. Shouldn't the ENB propose the specific timetable and the plan first before putting forward the conservation policy for the Deep Bay area? SEN, thanks very much, Professor Lau. I'm sure that the development strategy for Northern Metropolis has received positive response from the public, because this is a coexistence between development and conservation. We are making available land for housing, and this will be good for Hong Kong's economy, in particular for the innovation and technology. But at the same time, we do have a conservation policy to support Hong Kong's sustainable development. In terms of conservation, the AFCD will be commencing a macro strategic feasibility study to identify areas for conservation. A lot of people from the sector would be aware that all these processes would take a bit of time before we can produce all the data. So when ENB is launching the projects, we will be taking the matter forward. We will be seizing time to come up with all the information for us to take the matter forward. Professor Sun Dong. The Secretary, in his reply, please clip on the mic. Sorry. Thank you, Madam Deputy. In his reply, the Secretary said that there would be coexistence between conservation and development. I'm concerned whether there is any specific cooperation plan for the Northern Metropolis between the various bureaus to balance the carbon emission reduction. And when you build the buildings, are you going to be using the technology to minimize emission? emission in Hong Kong is 1.7 tons. Is the government considering in the northern metropolis any smart living as a proposal? Thanks very much, Professor Sun. I'm sure that this is the aspiration of the public when it comes to such a large-scale development. We do need to have the coordination between the departments. We're supporting the economic development. We are providing housing, and at the same time, we're integrating the environmental development. That the nation is moving towards carbon neutrality. I think we have to bear all these in mind in our development. Mr. Ma Fung Kwok, Madam Deputy, I'm really all in support of the Northern Metropolis Development Strategy, because this is really breaking away from the South-centric development, and we also break away from the old mode of having Shenzhen as the boundary in terms of our development. I think we can increase the housing supply. We can achieve a better integration with Shenzhen, and there will be development bonus, development dividend arising from that. My concern is that in terms of studies on ecological development, transport, and so on, it will take an awful long time, like the Lantau Tomorrow Vision, 3.5 years, Route 11, 4.5 years. Now, with regard to the Northern Metropolis, how much time are we going to be spending on these studies? Can we expedite the study while we are developing some of the areas ahead of others, while we are doing the studies? Secretary for Development. Madam Deputy, thanks very much, Mr. Ma Fung Kwok. Now, for Northern Metropolis, like Kau Yi Chau, artificial island, it's unlike the artificial island in Kau Yi Chau, at different stages of development. Say, for instance, anti-north new town like Queen's Hill area. The study, thanks to Let's Go, has already got underway. In some areas, we will be embarking on some new studies like Ma Chou Long. We haven't got any study that, we can change some of the parameters and get on with the study. In the coming few months, we will be able to embark on a new study. And you mentioned the environmental element. I'm sure that within this year, Mr. Wong Kam Seng has already said in his main reply, the study will also get underway. The study will take some time because there is a limit to the extent to which we can compress the procedures in the planning for land development. We are working full steam ahead, and we'll be coming to Let's Go in the coming 1 or 2 months. The CE has already said that without compromising the standards, we can try to streamline the procedures like the town planning and land acquisition procedures and so on in the coming few months. And we will be presenting them to Let's Go for some discussion. Mr. Stephen Ho, Madam Deputy, anti-north development, I'm sure nobody would raise any objection. Now, will the Northern Metropolis be shifted to the next administration? It's early days yet. Now, as we said, land development and conservation are not in conflict. That the SEN said that we're not compromising the conservation standard, that there are problems with the standard. The SEN keeps saying that we should have biodiversity. Now, my poll, now we talk about how many more migratory bird species are there. Now, the fisher folk are telling me that when they go in, they can catch a whole basket of crabs. Now they can only manage 2. Now, your question, please. I'm setting the scene. Now, my question is: the fisher folk have been driven away, and you are adopting the old standard. Now, my question for the administration is this: are you going to be adopting new standard Now, for the fishermen, I think you should get on with the conservation work for the fishermen in order to strike a balance between development and conservation. SCN, thanks very much for the question. I'm sure that in the northern metropolis, the conservation element would have regard to the sentiments of the egg and fish sectors, and there certainly will be proper management. There are still a whole lot of members who are following on this. Will you follow up on this on other occasions?
The final oral question. Dr. Tik Chi-yun. Thank you, Madam Deputy Secretary. Last month, the government indicated that the overall recurrent expenditure for the coming financial year would have to be cut by 1%, taking the current financial year as the basis. It is estimated that 164 non-governmental organizations receiving lump sum grant subvention, NGOs, will each on average be subjected to a cut of subvention by about $1.22 million, calculated on the basis of the current midpoint salary of 0.26 of an assistant social welfare officer or social welfare officer. This means that each of these NGOs will need to cut 2 such posts. The social welfare sector is worried that as the existing resources and manpower of such NGOs have already been in acute shortage, the failure to implement appropriate policies will render the underprivileged groups always unable to receive appropriate services. In this connection, will government inform this council first of the respective actual staffing establishments and numbers of subvented staff members of the subvented residential care homes for persons with disabilities, for the elderly, care and attention homes for the elderly, and daycare centers for the elderly in each of the past 3 years. Second, whether it has assessed the respective numbers of headcounts and service recipients that have to be cut by the NGOs due to the cut in funding by the government. And third, whether the Labour and Welfare Bureau has considered deploying the various funds of the government or social resources to make up for the cut in funding for the NGOs. Secretary for Labour and Welfare, Madam Deputy. Hong Kong's economy has been battered by the COVID-19 epidemic, and all sectors of the community have been generally affected to varying degrees. Faced with an economic downturn and given the significant increase in recurrent government expenditure in the areas of education, social welfare, and healthcare by around 32% from 2017-18 to 2020-21, the government must exercise extra prudence in managing public finance. As such, the Financial Secretary proposed in last year's budget that the government would implement an expenditure reduction program to strengthen fiscal discipline, with an objective to trim the recurring government expenditure by 1% in 2022 to 2023. The program is applicable to all policy bureaus and departments. Nonetheless, the government has decided that the cash assistance provided under the Social Security system, including those under the Comprehensive Social Security Assistance Scheme and the Social Security Allowance Scheme, will not be reduced under the program. Moreover, the Labour and Welfare Bureau and the Social Welfare Department, SWD, will give subvented and subsidized service units exemption on certain expenditure items on the condition that such exemption will not affect the implementation of the reduction program, and the SWD has written to social welfare organizations earlier to explain the government's reasons for implementing the reduction program and inform them of the specific expenditure exemption arrangements. My reply is as follows. First, in 2021, the government introduced the Lump Sum Grants Subvention Scheme, LSGSS, which has largely replaced the conventional social welfare subvention system. It was considered to be inflexible, complex, involving too many administrative procedures. The system seeks to focus on the effectiveness of service delivery, and hence allows non-governmental organizations, NGOs, greater flexibility and efficiency in utilizing public funds and providing quality services. It also helps simplify administrative work and enhance the quality of service substantively. Subject to their compliance with the requirements of the Funding Service Agreement and the relevant statutory staffing requirements, the NGOs may determine their staffing establishment in accordance with the human resources policies and flexibly deploy resources and employ staff to achieve their service output and effectiveness required. The government does not have to figure on the staffing establishment of the NGOs. Part 2 and 3. The government is committed to building a caring community and looking after the underprivileged. The recurring expenditure on social welfare has increased from $65.3 billion in 2017-18 by 62% to $105.7 billion in 2021-22. It makes up the biggest share of public expenditure among different policy areas, accounting for about 20% of overall recurrent public expenditure. After such a sustained period of strong growth, social welfare expenditure should enter a consolidation period with focus on implementing various improvement measures to ensure appropriate use of resources. Experience has shown that subvented organizations will adopt different measures to achieve the expenditure reduction, like streamlining workflows and reducing various expenses. Facing the heavy blow dealt by the pandemic and the severe challenges posed to our public finance, the government must strengthen fiscal discipline, introduce expenditure reduction measures, ensure the sustainability of Hong Kong's public finance and meet the long-term development needs of different sectors of the community. The government hopes that the public-funded social welfare organizations will also make optimal use of the public resources and formulate expenditure reduction proposals to achieve the objective of expenditure reduction program. The government will not provide additional resources for subvented organizations under expenditure reduction measures. Mr. Dick Ji-yang. Well, I think you know the welfare sector best. 6% has already been cut as out of the EPP. There's no room for further cuts. You said that social welfare accounts for the largest share of public expenditure. You need to wait for 3 years to get a place in the home for the elderly. For the disabled, a waiting period of 10 years. Do you really think that it is appropriate? You said that you dismiss my concerns with a light touch. You're still trying to introduce the cuts affecting the underprivileged. I know you try best to avoid affecting schools in the expenditure reduction programs. That's the good job of the Education Bureau. Secretary, have you ever considered doing the same so as not to affect the expenditure for the money for the welfare organizations? Well, for the lump sum grant scheme, I think the overall levels of cut have been 9%. All the time, we have been flexible in dealing with the need to cut expenditure. For the upcoming occasion, we have to cut the expenditure by 1%. It's got nothing to do with the level of output. We'll continue to introduce measures to reduce the waiting time for our services. Professor Nelson Lam. Thank you, Mr. President. I'd like to thank Dr. Teck Chi-yuen for asking this question. On my part, I do have many questions related to the welfare sector. We need to be accurate in our efforts to help the poor, but I'm sure I better take up such questions at the meetings of the welfare panel. Now, in relation to the Secretary's reply to our question, it is said that the government hasn't got the figures on the staffing establishment of the NGOs. It shows that the government will only provide subventions, the government will also formulate the policies, but I would expect the government monitor the usage of the funds, just like the monitoring role of the electrical. Instead of protecting the children have been abused. Instead of protecting the elderly, they are being abandoned. Now, it seems that you are having expenditure cuts all across the board. Even the supervisory staff members have been cut. So when it comes to allocation of resources, would you make sure that you will still be monitoring the performance of the NGOs? I think at least you should have got the figures on the staffing establishment of the NGOs instead of saying that you don't have it when you answer Ms. Dr. Tick's question. Supervisory staff will not be reduced. Indeed, in part one of my answer, we haven't got the figures on the staffing establishment. This is because 20 years ago, we introduced a change. We talk about quantity, quality, and effectiveness. For the inputs of the NGOs, that's not the focus of our monitoring. and I'm referring to the manpower level. Ms. Doreen Kwong, I know that resources are limited, but then for the underprivileged, they do have a keen demand for our welfare services. We'd like to have quality service instead of child abusing child care centers. How can you make sure that when there is a cut in the subvention, there will still be adequate and high quality service for the welfare service recipients? Secretary, as I've mentioned in my main reply, we are talking about optimizing the use of public funds and the subvention. As I have said in my reply to one of the members, we are interested in the quality. We are interested in the quantity of the service provided as well as the effectiveness of the service. This is an ongoing exercise. I'm sure the NGOs will be flexible in the use of resources so as to meet the expectations and requirements of quantity, quality, and effectiveness. Reverend Canon Kun, Mr. President, I understand that there are financial issues in the midst of the pandemic. But in fact, we know that there are challenges in the midst of the pandemic. I just wonder if the Secretary will suspend the cut by 1% so that we can tie over the difficult time together with the NGOs. Secretary, as I have said in my main reply, the surprise across the board to all policy bureaus and departments is not the choice of an individual policy bureau like the Labour and Welfare Bureau. Mr. Chen Yong, thank you, President. Thank you, Secretary. I'm sure the Secretary is most familiar with the case of the welfare sector. I think in the midst of the pandemic, there's a growing demand for welfare services instead of a decrease. Now, when you cut the expenditure to such a magnitude, people will be affected. $200 million each. You have got the Jockey Club Charitable Fund as well as other funds. I just wondered if you can make use of those funds so as to fill the shortfall, safeguarding the interests of the public. The DAB has received queries from the public. They do have such a sort of request. They want to have more services. They would like to see a better allocation of resources, in particular for the well-paid senior officers. For those that are not performing well, you can ask for improvements and adjustments. But in general, the amount of expenditure should be maintained, if not increased. So, Secretary, would you consider exempting them from the $200 million cut or deploying other means to make up for the shortfall in the subvention so that the welfare of the members of the public could be safeguarded in the midst of the pandemic? Secretary, quite a few elements are involved in the supplementary question. In my main reply and in my replies to the supplementary questions, they have been referred to. So I'm not going to repeat myself. Just let me fill in on one other point in the question. Yes, the Labour and Welfare Bureau will try its best to get resources to meet the needs of the public in relation to welfare services. Mr. Lai Dong-kwok. Mr. President, my understanding is that the government would like to cut the public expenditure. This is because the government would like to make sure that the remaining public funds can be put to optimal use. Now, in the welfare sector, we have been surprised by the abuse scandals. Will the FS consider the following? 1% is the level of cut. Are you going to spend the money saved on enhancing the supervision of the NGOs? Secretary, as I have said in my reply to other supplementary questions, as far as the LWB is concerned, We are aware of the aspirations of the society. We'll continue to try our best to get resources to deliver the service. We are not going to be relaxed in our supervision. Proposed resolutions to extend the period for amending subsidiary legislation. Members' motion on the period for amendment legislation. Proposed resolution to be moved in accordance with the interpretation and general clauses ordinance. Proposed resolution to extend the period for amending the Prevention and Control of Disease Use of Vaccine Amendment Regulation 2021, which was laid on the table of this Council on 20 October 2021.
President, I move that the motion as printed on the agenda be passed. I propose the question that the motion moved by Ms. Sari Lee be passed. I'll now put the question to you as stated. Will those in favor please raise their hands? Those against please raise their hands. I think the question is agreed by a majority of each of the two groups of members present, that is those returned by General Election Committee and those returned by FCs and GCs. I declare the motion passed. Members of the motions, two proposed resolutions are to be moved by Ms. Sari Lee under Article 75 of the Basic Law and the Legislative Council Powers and Privileges Ordinance. First motion to amend the rules of procedure in accordance with Article 75 of the Basic Laws to specify the procedure and relevant matters on conducting meetings of the Council or committee remotely. And second motion to authorize, in accordance with the Electoral Powers and Privileges Ordinance, the Council or Committee to conduct meetings remotely within a specified period by means determined by the President. Members have been informed that this Council will proceed to a joint debate on the two motions. Upon the conclusion of the debate, this Council will put to the vote the two motions one by one. I'll remind members that the maximum duration of this debate, including voting, is 4 hours.